let's start over here with roll call. Mr. Butita,
Here.
Mr. Arena,
Here.
Mrs. Gorel. We're doing this again, Angie. Mrs. Gorel previously mentioned that she was present. Mrs. Red.
Here.
Mr. Westcott, do not see him.
Dan,
right.
can you hear me now?
Yes, we can hear you now, Angie.
Thank you.
And Mr. Fellers, I am here. Mr. Booker is having tech issues, but he will be here shortly. We have a quorum. Seeing that no one signed up for public comment, we'll go ahead and skip the public comment phase and move right along to item D, a resolution extending the proclamation declaring the county of Winnebago of Illinois a disaster area for coronavirus response. This is the second extension, and may I have a motion?
So moved.
Motion by Angie, second by Mr. Butita. Discussion. Mr. Arena.
When does the first extension expire?
Mr. Chairman, I see that you're here. Could you just give us let us know when that expires?
It's a good question. I think it's within a couple of days. I see Dave Kerlinkis is on the line. If it's it might be the 25th, perhaps.
It was initially done on the 7th, right? And then I thought we had a couple weeks, I guess is my point.
No, it's it's getting towards the end of April. Oh, go ahead, Steve.
Yeah,
Mr. Chapman.
the resolution states that it expires on April 30th, I believe.
That's correct. If you look at the resolution, it was approved on March 19th, extending the proclamation to April 30th. This is Marilyn. Hi.
Mr. Arena.
So to follow up, we're extending it from 45 days from April 30th. Is that correct?
Yes.
Okay, and then
It extends to June 14th.
okay, and then just for the record, I had spoken with the state's attorney's office today, and I was told that this has nothing to do with our decision-making process and closing businesses. Is that correct?
Correct.
Okay, thank you.
Are there any other questions regarding the resolution proclamation? Seeing none, all in favor, would you please just raise your hand?
Aye.
Aye.
Thank you, Dorothy. Thank you, Angie. Are there any opposed? All right, resolution passes. Moving on, we have a resolution extending intergovernmental cooperation agreement for police services with the village of McChesney Park to May 31st, 2020. May I have a motion?
So be it.
Motion by Mrs. Gorel. May I have a second, please? Second by Mr. Butita. Rick, I see you're here. Do you want to just give us a quick update here?
Sure. Just as a quick update, we've been negotiating with McChesney Park here probably since about January. We've reached an agreement in concept. The state's attorney's office has reviewed that. They made some changes. The changes have been sent back to McChesney Park, to their attorney, Tom Green. We will be meeting, I would imagine, sometime in the next 7 to 10 days. I anticipate that this agreement should go pretty smoothly. Once we have the contract agreed to, we'll bring it back to the committee and then the board.
And you think that through May 31st is enough time to get all the last bits and pieces done?
I think at this point, I think we should, that's a realistic target. We should be ready by May 31st.
Great. Any questions from board members? Mr. Arena.
Thank you, Mr. Chairman. It was my understanding that the last contract that we approved was at a $200,000 a year loss to the county. It cost us $200,000 more in personnel costs than the contract covered. And considering our current financial situation. I'm wondering, has that gap been closed now in whatever you're negotiating for the new contract?
So I would tell you that the negotiations, I think that we're looking to basically, excuse me one second. We're basically looking just to police at our actual costs. Mr. Chapman is on the line. Mr. Chapman has actually looked at the financials, so maybe he could give a better update on where we're at with the financials of that.
Okay. You know,
Yes, I am. We have, reviewed the costs. I think we tried to incorporate all the costs relating to the individual employees that would be assigned to the McChesney Park area, including the retirement cost, workers' comp, et cetera. I think in the past, some of those costs were not necessarily recovered, but I think they are incorporated into this agreement.
thank you.
Any other questions from board members?
Dan,
Yes, Angie.
I would,
Well, do you have, I guess, tell me what's going on.
Dan,
Yes, Ms. Gorel. Mrs. Gorel.
let's make sure that those figures are right, so we don't take another loss before we pass this. Can we lay it over for a week and make sure all those figures are right, or can't we? Steve's saying no.
Well, if I'm clear, this is the extension so that they can continue to negotiate the long-term agreement. Yes.
All right.
That's correct, Mrs. Thorold. We are extending the current agreement that the sheriff has until they can get the new agreement in place.
So we gotta get rid of one before we can get the other one. Okay.
Correct.
All right. Thank you.
You're welcome.
Are there any other questions on this matter? Seeing none, all members signify by raising their hand or saying aye.
Aye.
Any opposed? Motion passes. Are there any other matters before the Public Safety Committee? Rick, are you just cleaning your screen or you have a question? That's something else to bring up.
I'm
think we're
sorry.
good.
No, I have nothing. I'm just trying to mute my phone here. But
No problem.
nothing else.
And just as a reminder here, I'm looking at the agenda for the Public Safety Committee. There are 3 other resolutions coming before the board tonight. Subcontract agreement with the Department of Justice for Violence Against Women, which was previously approved. The resolution approving subcontract agreement for the County of Winnebago County Problem Solving Courts, and the resolution renewing the annual maintenance agreement for X-ray scanners. All of this were approved at a previous meeting. Are there any other items before the Public Safety Committee? Seeing or hearing none, may I have a motion to adjourn?
Motion to adjourn.
Motion by Mr. Gorel, second by Mr. Butita. All in favor, raise their hand or say aye.
Aye.
All right, we are adjourned. Thank you very much.
Good job, Mr. Feller.
Thank you. Times like this, you just gotta be flexible.
That's right. We're all learning that.
Whatever that was. Oh, baby.
Are we using the same hookup for the county board meeting, or do we have to log out and sign in again?
The next
Same.
committee meeting and the county board meeting will all be on this feed.
Okay, thank you.
Okay, folks, without further ado, I see my Public Works Committee members and staff available here. And if you all don't mind or whatever, I don't know what works best, but for my purpose, if you all unmuted, this way, if you wanted to chime in or say something or whatever, I think for the purposes of one item here, it might go a little better for us. But I'd like to call the Winnebago County Public Works Committee meeting to order here, 5:45, Thursday, April 23rd. Present is myself, Dave Tassoni. I see Bert Girl, Jim Webster, Dave Kelly. I see Carlos Molina from the Highway Department. I see John Gilberti there as our state's attorney backup. First item of business, I'd ask for approval of minutes from, I guess, none. No approval of minutes on, no, March 3rd.
So moved.
From March 3rd. Any corrections, deletions, or concerns around that matter? Oh, no, that was the last meeting. Sorry, there are none for this meeting. So we'll forego that. We'll also forego public comment, seeing there are none, and we don't have that capability right now. But the first item on the agenda would be a resolution. It's 20-018. The resolution authorizing the award of a bid for the Baxter Road widening and resurfacing from I-39 east of Mulford and Mulford Road. And I would so move.
Second.
Seconded by, I don't know, who seconded by Mr. Kelly. And like I say, basically the bids that came out a couple of days ago, I don't know if everybody had the opportunity to see them, but it was $3,383,000, and we're recommending the awarding to William Charles. And if anybody's got any questions and Carlos wants to speak to any other details on that, you can have the floor. Any questions, comments, concerns on that item? That's been long awaited, and like I say, with the help of Steve and the board's approval for our bonding issue, it's going to make it possible for us to complete this project. Mr. Webster.
Yeah, when are they scheduled to start this project? Carlos?
We have not had a pre-construction meeting yet, so I can't answer that yet.
Okay. Thank you.
Any other questions or concerns from the committee? All in favor?
Aye.
Aye. Any opposed? Mr. Chapman would like to add to that?
Yes, just one item. Based on the bids that we received versus the estimates that we received, we're probably going to be looking at reducing the bond amount that we actually end up selling. Tentatively, we're looking at May 15th or May 14th meeting to sell the bonds, but that's subject to having a quorum physically present in the county boardroom. That's what our attorneys have indicated that is required to satisfy their needs. So that's something that we'll have further discussions on, but I think originally, I forget what the amount was, but I think we're going to be looking at reducing that. So that should reduce our payments each year. So.
Thank you for that, Mr. Chapman. And as well, I had some conversations with Mr. Molina, and like I said, overall, based on what the bids come in as far as our Kishwaukee Road project that's attached to this bond as well. At the end of the road, hopefully we don't need as much money as we expected. So, and with that, Mr. Molina, is there any other items as far as any reports from you or anything else?
No, I don't have anything else. Thank you.
Okay, and with that, if there's no other questions, comments from the committee, I'd move to adjourn.
Move.
Second by Mr. Webster. All in favor?
Aye.
Aye. Okay, guys, we'll see you in a few minutes. Thank you.
Thank you.
Hey, Clerk Gamow,
Yes, Mr. Chairman.
did I see there was, you had your recount for the one county board district?
We had a discovery session for the county board district on Tuesday, and we had a discovery session for the state's attorney's position today.
Wait, could you repeat that? You clicked in and out on me. I'm sorry.
We had a discovery for county board position on Tuesday, Today, we had a discovery session for the state's attorney's position.
Okay, gotcha. Hmm.
Hey, Frank, I have a new background image for you.
There you go. What kind of background does Jim Webster have going on there?
I believe they call that fuchsia, but I could be wrong.
That's me.
We just had an intermission between a committee meeting and the board meetings about to start.
Lori? Ms. Gama?
Yes.
My wife here is here and she wants to ask you a question.
Okay.
Hi. I've had this question asked of me. We all know that campaigning this year is going to be different than campaigning in other years because I've heard, that door to door is pretty much out, and it could be out most of the summer. The question that has been brought up is beginning in August, your aldermen in mayor have to go out and get.
Hey, Karen.
tickets.
Yeah, Karen, it's Frank Haney. We can't hear you. Your connection's real bad.
You will have to go door to door. Is anybody thinking about that?
Karen, you're gonna have to call me at the office. I can't hear you.
Oh, that means you can hear Joe.
Hello?
Let's see.
You'll have to call me at the office.
Can you give Joe your number at the office and I'll call you? Because
Okay.
I got you. Oh, okay.
All right. Thank you.
So they're not gonna be able to hear you in the meeting.
See you,
Thank
Karen.
you.
Okay, since you can't hear her, can you hear me? Was it just her?
We can hear you right now.
Log out and log back in.
I mean, quit laughing at me.
I'm wondering if you log out. I'm having connection problems too. I wonder if you log out.
If you can, try to move closer to your router. Try to move closer to your wireless router. That's your best bet.
No,
I don't
have one in here.
Where is it?
I don't have a wireless one. Is it wireless?
Yeah,
It's up behind the picture there.
We have Chief Bergston from the city of Rockford, and we got Karen Hoffman, alderwoman from the city of Rockford. So Karen, we're going to have Clerk Gummow and you connect offline. Sorry that we couldn't hear you very well. My apologies. Okay.
Okay.
All right. You be safe.
Thank you.
Okay.
Maybe the doorman shuts about there.
We're going to go ahead and have everybody mute their computer screens or phones. And then when you go live to talk, we'll have you unmute. And by the way, you've been sent a few emails within the last hour that we wanted to get to you. Many are in front of your computers right now, so it might come right to you. We'll go ahead and call the meeting to order. We do not have any agenda updates. With that, I will ask the clerk to call the roll, please.
Thank you, Mr. Chairman. Mr. Billich. Mr. Billich. Mr. Booker. Mr. Booker. Mr. Butita.
Here.
Mrs. Crosby.
Here.
Mr. Fellers. Mr. Fellers.
Here.
Mr. Fiducia.
Here.
Mr. Girl.
Present.
Mrs. Gorel.
Present.
Mr. Hoffman.
Present.
Mr. Kelly.
Here.
Mr. McDonald.
Here.
Mr. Neighbors.
Here.
Mrs. Red.
Here.
Mr. Salgado.
Present.
Mr. Schultz.
Here.
Mr. Tassoni.
Present.
Mr. Webster. Mr. Webster. I can see that his call is on the line, but he's not unmuted.
There he is.
There he is. I'll take that as a sign. Mr. Westcott. Mr. Westcott. Mr. Arena.
Here.
I'm
Thank
here.
you, Chairman. We have the three absent that I have as Mr. Billich, Mr. Booker, and Mr. Westcott. Thank you.
Thank you. Thank you very much. I'm sure Mr. Booker was with us for the public safety meeting just a minute ago, so I'm sure he'll be joining us again. We also have Rockford Fire Chief and point person for the Emergency Operations Center, Chief Bergston. We got our coroner, Bill Hintz. We obviously have the state's attorney, Ross, Dave Kerlinkus. And I believe very shortly, Dr. Martell from the health department should be joining us if she's not tied up on something else. And then, of course, I do see Mr. Booker joined as well. With that, I know it's been, I know since we've gone to the Zoom that we have not done the invocation. Tonight, we do have Mr. Salgado up. I'll put that as an optional thing. If you would like to lead us in the invocation, I'd ask everybody to actually stay seated so that we're not spending the next minute looking at your navels. But I'll turn things over to Mr. Salgado.
Thank you, Mr. Chairman. Everybody bow their heads. Heavenly Father, first and foremost, thank you for all that you've given us. Heavenly Father, we ask that you guide us in making the right decisions for our county. Heavenly Father, we ask that you protect us and our families from the current pandemic. Heavenly Father, we ask that you protect and give strength to our nurses, doctors, and first responders to keep us safe. In your name, amen.
Amen. Thank you. With that, and again, don't in any way mean to disrespect our tradition. We'll ask everybody to stay seated and we'll do the pledge. I pledge allegiance to the flag.
The flag of the United States of
The States of America.
To the republic
for which it stands,
one nation,
under God, indivisible, with liberty and justice for all.
Thank you very much, everybody. Thank you, Mr. Salgado. We do not have any public comment tonight. I'll back up here. I missed really one of the most important parts of the meeting. We talked about providing a COVID-19 response update. There are several items I have for you tonight. I'm going to go ahead. Chief Bergston has been the point in the Emergency Operations Center. I'm going to give him the floor. What I'm going to do, I think he needs to run after he just gives an update on EOC stuff. And then Ann Johns will be talking about purchasing PPE, some expenses related to the Emergency Operations Center that will be likely fully reimbursed for, I believe. But that'll be a second part. Dr. Martell will speak. There's also state level news with the governor's extended executive order that is consequential beginning May 1st. We won't probably even get to the bill passed by Congress, which there's so many big things going on. The other big piece of news today is we announced at the University of Illinois College of Medicine, something that actually Chief Bergston deserves a ton of credit for, Dr. Martell, the University College of Medicine, the Illinois National Guard have partnered around community-based testing. We'll be able to pump out 500 tests a day, 7 days a week from that site. And we'll get into a little more detail on that. There is going to be a second community test site that's going to be announced in the coming days, likely on the west side of Winnebago County, west side of Rockford, more likely than not. And that'll be tied in with a partnership with Crusader Clinic. The big picture there real quick before I turn it over to the chief, we've in a month and a half of working pretty hard on testing. We only have about 2,100 tests. We're going to be able to, between those two sites, pump out 500 tests a day times 2 sites, so 1,000 tests a day, 7 days a week. Testing is key to containing the virus and also putting us, as it has other parts of the country and more, I guess, more specifically other countries, from getting back online business-wise, getting back to the things we all want to see come back. So with that, I will turn it over to Chief Bergston and thank him for his team and the EOC leadership team for all their hard work. Chief, are you there?
Yes, I am. Can you hear me?
Not very loudly.
Not very loudly?
Yeah. Can you speak a little closer to the mic?
Sure. How about now?
A lot better.
Okay.
Louder would be better even.
All right. Well, I appreciate you giving me an opportunity to just kind of give an overview tonight. Especially want to thank Ann Johns and many of the staff at the county for their support and participation at the Emergency Operations Center. We're in our 43rd operational period. So 43 days we've had the EOC open and operating at the County Justice Center, which is about setting a record for Winnebago County and the city of Rockford. And it takes a lot of people to do that. And we've had great participation countywide from different agencies and government entities helping staff that. It's roughly staffed between 18 to 24 people a day working there and responding to requests and preparation for the next incident objectives that we have to deal with. So I know Chairman Haney gave a quick overview of some of the things, but the staff, they're doing an incredible job. Things are very fluid and continue to change. We get updates from the state and the IEMA on new initiatives, new guidelines that we have to get updated and out to all of our emergency responders, and also especially our assisted living facilities where we have some challenges that are going on there. But every day we meet with all the hospitals to gauge what their admissions are, what their capacity is. That drives a lot of what we do. And then the chairman alluded to, we were the first community in the state to have the National Guard partner with a community. All the other areas throughout the state, they've come in and run it themselves. They came to our EOC about 10 days ago. They were very impressed with how our EOC was running, with how many stakeholders and the collaboration that we had, that they said, we'd like to partner with you, which says a lot to all of our organizations at the county and the city. So we did a tour there today. That's going to start up tomorrow from 8 to 4, like the chairman said. And then we're really cognizant of covering the entire community, east side and west side. And we have another one that's going to be opening on the west side that's going to be addressing populations that are challenged with driving. It's going to allow walk-ups and just be able to hit our entire county with a good coverage. Like I said, that's a quick overview. I'll be more than happy to take any questions, but I know everyone's busy and you probably got a busy agenda just like we do at the city every week. But if there's anything else you want to cover, Chairman, I'd be more than happy to. If not, if anybody has any questions.
Yeah, just real quick, Chief, a little bit about who's helping out in the Emergency Operations Center. This was a new paradigm for me and I think for our board members. I do know Keith McDonald, Mr. McDonald has a question in a second, but if you could just give a little bit on an average day, what's going on, some things in the EOC, who are you getting help from? Who are some work groups and some faces you might possibly see in there? Then I'll turn it over to Mr. McDonald.
Yep. So in the EOC, every day we have a representative from the Sheriff's Department, the City Police Department. We have the Health Department. We have public information officers from organizations throughout the county that rotate through to assist with handling information. It's also where all the calls are answered for the Health Department for people calling to complain about business open or questions or other interesting things that they do take a lot of phone calls. But then we have staff from Fire Department, not just the city, but other surrounding departments. We have nonprofit organizations that bring their staff in there, and other county organizations that are dedicating staff to assist the operations at the center.
Got it. Thank you, Chief. Mr. McDonald, you had a question?
I do. It's more of a statement. Thank you, Mr. Chairman. Hey, Chief, how are you doing? I know over the last year, you and I have spoke about having a NIMS type class for elected officials. It's a little bit of a day late and a dollar short for this particular event. I've been mentioning it several times. Do you think once we can finally get face-to-face, are you still willing to do a NIMS level so the electeds can kind of understand what's going on in the EOC?
Most definitely. We had that planned actually for the month of March because we had that upcoming drill in June that we were awarded a federal grant for the Emergency Management Institute, but it looks like that's probably going to be put on hold. But once this is over, I think this is a great opportunity, why it's fresh in everyone's mind, to get as many county board members, elected officials, and department heads to attend that class. It would definitely have some significance.
Outstanding. Thank you, Chief.
No, thank you for your support.
Any other questions for the chief right now? Okay, seeing none. Chief, thank you very much. I'll let you get on with your night. And I see do we have Dr. Martell on? Chief, thank you again.
Nope, thank you for having me. Anytime you need something, please let me know.
Okay. Thank you. Do we have Dr. Martell on right now? I don't hear that. So we have Coroner Bill Hintz, I believe, has joined us. And there's been some questions that I think some clarity would be helpful around the how COVID-related deaths are handled. There's one person who signs a death certificate in Winnebago County when there is a COVID-related death, and that is the coroner. At this time, Bill, are you there?
Yes, I am.
All right, thanks for joining us. I'll give you the floor, but could you maybe take the group? There's a lot of national, state, and even local questions about that. Could you just kind of share some of the things you shared with me yesterday, and then see if there's any questions? And again, we're talking specifically in the unfortunate situations where we have somebody from the community die, pass away, and it is either suspected of a COVID-related connection. Go ahead.
Yes, yeah. Can everybody hear me okay?
Yep, go ahead.
Okay, sounds good. Well, thank you, Mr. Chairman.
go ahead.
Thank you, everybody. So basically, the one thing I'll start with here is who determines if a patient dies from COVID? And basically, it's kind of a long-winded answer, but what happens is this: to start with, on every COVID-19 death that is suspected or confirmed, I always talk with the funeral home right away, whether it's 2 in the morning or 2 in the afternoon. I explain to them what is happening. I'm affirming with them that they're taking all their precautions necessary. Then talk with the health department, again, whether it's 2 in the morning or 2 in the afternoon. I let them know what's happening. I update them on the patient information. And then before we sign the certificate, I end up talking with the doctor that's taking care of the patient. I find out the past medical history. I find out medications that they were taking. I find out if they were tested for the COVID-19 and which lab did they use. Then we talk with the doctor and I ask them about the symptoms. If they've had any symptoms that were in line and were consistent with this virus. All these pieces of the puzzle come together to form the picture. That's when we decide exactly what to place on the death certificate. That can be a process that can take 1 or 2 days, depending on all the information we get in. But I feel it's important that I don't hurry or rush to sign a certificate. I want to make sure I have everything together. This is something that I take pride in with this office. My predecessor taught me this, and I continue this, that I firmly believe that we're the last voice for this person. And I want to make sure I get it correct all the time. As to date, right now, we have 12 individuals who have passed away from COVID, meaning COVID-19 is on their death certificate as either a primary cause of death or a contributing factor. The other thing, just to let people know, is we've had 34 negative COVID deaths, meaning these are deaths that were reported to us, the hospitals, the individuals going through whatever medical process they're going through that we thought that might be COVID, but we ruled it out. Either the test results came back negative, the pieces of the puzzle weren't there when we were talking with the family doctor, whether it be the intensivist, the hospitalist, the whatever doctor that knows this patient the best, the pieces weren't there. And I was very comfortable saying, you know what, this is not COVID related. I know somebody else had a question a while ago that they were talking about, can an individual be tested for COVID if they've passed away, or do they always have to be alive? And the answer to that is yes, tests can be done before and after death.
So just to recap, I see a hand up, and I'll go to Mr. Girl, but the one thing that I learned from you was that yesterday it was 28. Now you're up to 34 folks who have, unfortunately, in our community passed away. There was some aspect of COVID. It appeared to have some level of COVID symptoms, but you determined that that would not be put on the certificate. So there has been national, state, and local questioning of numbers related to this. And what you're saying is now more what in experience is that you're almost 3 to 1 at this point, looking at the numbers that to this point there's been more not COVID related than COVID related. Is that accurate?
Exactly. Yep. Just also keep in mind our numbers haven't declined that much either on our routine deaths, the deaths that we because we average anywhere between 10 to 14 deaths a day in a 24-hour period, in addition to the COVID related deaths. So we're still taking care of everything that we need to.
Got it. You had a question, Mr. Girl.
I do. Thank you, Mr. Chairman. Question for the coroner. Bill, appreciate everything that you do for us and what you do for this community. I know there was some talk on social media from some other folks, some elected, some past electeds, that somehow you are being told that to change these death certificates to inflate the COVID numbers. Can you just elaborate on that a little bit, please?
Yes, I did hear that rumor as well. First and foremost, no, I have not had any pressure from elected officials, from government officials, from physicians, from anybody whatsoever to either underinflate or overinflate the numbers. Again, doing this job for 21 years plus now, I take great pride in what I do here. I will not place, and it doesn't matter to me whether it's COVID, whether it's a flu, whether it's a heart attack or diabetes, whatever ailment, whatever disease this person has, I want to make sure that I get it right no matter what. And that is something that I don't have anybody pressuring, or nor would I accept anybody trying to pressure me for this whatsoever.
Thank you so much. And I knew 100% that that was the fact and that was the truth. It's just, it seems it's a shame that people are going through, maybe it's just a self-boredom at home, but people are coming up with stories that are untrue. And I really wish they wouldn't do that. But I want to thank you for your service to this community in this county. Thank you, Bill.
Absolutely.
Any other questions for Mr. Hintz? Mr. Reed.
I have one. This is Dorothy Red.
Dorothy, hold on. Mrs. Red, hold on 1 second. I got Mr. Arena, then I'll come back to you, Mrs. Red. Go ahead.
Thank you.
Yep.
Thank you, Mr. Chairman. Mr. Hintz, you mentioned there was 34 people who had passed away where there was suspicion of COVID, but then you decided that it wasn't. Of those 34, were any of them actually tested positive and you just determined that that wasn't the cause of death, or were all 34 of those people negative for the virus?
All 34 of those were negative. All of them were tested. All of them came back negative. And then that was part of the puzzle. While we were waiting for the test results to come back, that's when we were on the phone or actually at the hospitals or nursing homes or wherever we were at to talk with the doctor, to go through the medical records, to go through the charting. A lot of the patients that passed away at the hospitals have been there for several days. So there's a lot of documentation to back up exactly what either the hospitalist or the intensivist is telling us.
Okay. And just to follow up on Mr. Girl's comments, I had also seen on social media a comment that of the 12 that we have listed as COVID-related deaths, that 4 of those people were in hospice because of another terminal illness. Is that correct?
Yeah, there were a few that were on hospice. Definitely. Yep.
But So in that case where somebody's terminal, you're still considering that as a COVID death because you feel it contributes to the time that they passed away, or explain that aspect of it, please?
Sure, absolutely. So what happens when somebody passes away with hospice? Obviously, they have an end-stage diagnosis of some ailment. But the hospice patients that so far that we have come out of one facility, has come out of Annam Care. And from what, before the first person had passed away out of Annam Care, we had been on the phone a few times with the health department, direction of Dr. Martell. I know that we were advised to consider everybody at Annam Care, in quotes, positive, suspected positive. So what I did at that point is that was another piece of my puzzle. I took a look at, we have an end-stage diagnosis. I have the COVID-19 virus that is suspected in this building. We ended up, the first couple were actually tested and came back positive. And then again, talking with the family physician, and whatever the end stage ailment was, we did take that into consideration, but we also, again, with the guidance of the physician, determined that one of them was definitely a suspected death that was due to COVID. One of them was a contributing factor, so that we did use the end stage ailment as the primary cause of death, but we used the COVID-19 suspected, using the word suspected for the one that was not tested as the contributing factor.
Okay, thank you for the explanation.
Sure.
Thank you, Mr. Arena. Mrs. Red.
Thank you, Chairman. My question to the coroner. I know this young man that died in early February. He passed away suddenly. He had heart problems from the past. How do we know he did not die because of the COVID-19 virus?
Are you talking that individual in particular?
Yes.
Well, I would have to take a look at that individual's records, at the chart. I wouldn't be able to speak without knowing exactly where this person passed away, what doctor they were seeing, what they were being seen for, the different medications they were taking, that kind of stuff. So I could definitely talk offline with you and be able to pull some more information up, but offhand, I wouldn't be able to speak directly to something like that.
Right, okay. Well, I'll give you a call.
Yeah, absolutely. That's not a problem.
All right, thank you.
You bet.
Yes, sir, Mr. Webster. Thank you, Mrs. Red. Mr. Webster, then Mr. McDonald.
Okay, thank you. Following up on this conversation, this dialogue here, I'm curious, is there any tracking there about people that have had or gotten the flu shots and versus people that hadn't? And so we talk about people that are more in a weaker zone, a weaker state or whatever, more susceptible to being open to the COVID, whether it's due to their age or their health, whatever shape they're in. Is there any correlation to people that have already gone through the flu shot thing? Or I realize that's two different things altogether, but I just wonder about things like that.
That's a very good question. I'd open it up for either, I think Dr. Martell is on, and or Bill Hintz. Do either of you, would you like to respond to that or answer that question?
Yeah, this is Dr. Martell, and I'm sorry, the only way I can get is by phone, so I apologize. First of all, they're looking at all of that data. As you know, we're beginning to see more and more of asymptomatic transmission, so which is why things that people are going a little back in time. They are gathering data on whether or not they were vaccinated. Initially, when we were testing people, they had to rule out first flu and any of the other, what we call a respiratory viral panel. So it tested for other coronaviruses as well. But this time they don't see, again, it's too early in the game. And I'm sorry, Mr. Webster, we continue to monitor the information, but we don't have anything where there's a direct correlation between flu vaccine at this point.
Yeah, and I just wondered because how many people there that currently have COVID, they already in a weakened state because they had flu. I guess that's what I'm wondering.
Well, here's, the interesting part is most individuals in long-term care facilities, remember, they are typically vaccinated for flu. Again, they're a high-risk population. And as you probably, probably don't pay a lot of attention throughout the year, but when we do the flu reports, we do indicate where there's outbreaks in long-term care facilities. And interestingly enough, we did not have a lot of outbreaks of influenza activity in long-term care facilities this influenza season. So we continue to look at all the factors. And I did want to go back a little bit about, I heard some discussion about the death certificate. And Bill and I know this is a constantly evolving situation. When we talk about, we now call them, when you talk about long-term care facilities, it's the thinking now is once you have one positive or two positives, well, usually it's a staff and a member, that you kind of consider that. We call it a location of concern. We don't really want to refer to it as a hot zone because these are people's homes. And so the idea is that really for that congregate population that there's a great chance that there is transmission like there would be for a household contact. So in this case scenario, on top of it, as he said, we take a look and make sure, but then they also take a look at what were the clinical signs and symptoms. So not only everyone in those places, once you have a positive, the staff is monitoring the individuals in those units, both for what we call their temperature twice, vital signs, and what we do pulse oximetry, which is checking the oxygen levels in their blood. So again, those are all the clinical things that go into that. And as of the 20th of April, so we're talking Monday of this week, they began to talk about this idea of probable COVID-19. And again, not everyone who's dying right now is dying of COVID-19, but but every death now needs to be considered suspicious, given, especially if it's a pneumonia-related cause. So these are things that are constantly changing, we're constantly evolving. The goal is we certainly don't want to underestimate the death, and we don't want to overestimate and create, concerns and issues as well. So these are very carefully looked at all times. And we do not, again, as the registrar, I do not even, I only see it once the coroner has determined that the death is from COVID-19. It becomes part of our reporting.
Okay, thank you. Can I have one more follow-up question, please?
Yes, go ahead.
Okay, Martell's on the line. Okay, so we hear about this talk about the governor has secured 17 million masks or $17 million worth of masks or whatever. And so I'm asking this question because one of our residents of the county said they can't find masks anywhere. And so there's this huge stash of masks somewhere. How are they going to be distributed? How can people have access to this stockpile of masks? And
yes,
cost them money, or can they, get them delivered?
Yeah, let's do this, guys, on this particular question. We're going to come back to PPE very shortly, and Dr. Martell will be with us on that particular segment as well. Ann has some specifics to share. There's going to be a robust discussion on PPE. That'll be the first one.
But I also think, Chairman, it would be important for the board to understand about this, and then we can talk about purchasing as it goes on. First of all, at the beginning of this, the Emergency Operations Center, as the health department, we have very small, what we call cache of PPE that we have available for an emergency use. At this point, we have distributed and dispensed it all out. Through our Emergency Operations Center, there is a person whose whole job it is to look at logistics, to be able to, we take all the supplies in, they put it all together, and they calculate what we call burn rates, right? How often does a health center or a long-term care facility use it? We've heard a lot about that. And then we put requests up to the state operations center as well as individual purchasing. So then you'll hear about the individual and what I'm going to call it like county level purchasing coming up. But you're right. This has been kind of the catch-22 and the catch-up that everyone is playing about the supply of personal protective equipment, which has impacted both our healthcare facilities. And as we go into now, you've heard the governor kind of talking about then masking of people when they're out in public and different levels of PPE. And so, Chairman, then you can go certainly into the next level. But I think people need to understand we've already turned over what we have in supplies and basically based on our hospital usage. But I can tell you that there's been a nationwide shortage. You know, are keeping up on the national pieces as well. It's very hard at this point to purchase and to come by.
Thank you very much. We'll circle back on that. Mr. McDonald may have had a follow-up for Mr. Hintz.
Thank you, Mr. Chairman. Actually, I do have two. I've got a question for Coroner Hintz, and I also have a question for Dr. Martell. The first being, Coroner Hintz, you said that there's 12 deaths. Earlier, you stated that the COVID is being listed as a primary and sometimes secondary cause. Do you know the breakdown on that? How often it's the primary cause versus the secondary?
Only one time have we used it as a secondary. The rest of them have been primary.
Thank you very much, Coroner Hintz. The other for Dr. Martell, I know there's a lot of talk about antibody testing. New York's done some, California's done some. They're finding, from what I've been reading, that this has gone a lot further through their community than what they had first thought. What's the county's plans on antibody testing to see how far this has already gone through our county and at what point we can start making a turn?
Well, here's the interesting part in that. The antibody testing, then you've also read, has a lot of flaws associated with it. And that's not to say that it won't progress and be better, you know, as we move forward on this. But right now, the issue that we have is we still have active infection going on. So the testing that's going on right now, there are a couple things going on. So we're doing what's called the diagnostic type testing, which when you can do it, can tell whether or not you currently have the infection, even if you do not have symptoms. So we call it the nasopharyngeal swabs. The antibody testing, if you test positive on that, the problem that we have with that is that we then have to go to the second step, which is to determine whether or not that's a recent infection or a current infection. So the antibody testing has not progressed as far along as we would like. Eventually, the goal is to have an antibody test like we do now when people go into healthcare and they'll say, are you immune to, like, say, varicella or chickenpox? They do an antibody test, and there's good reason to believe that you're going to be protected. The other part with antibody testing that we're kind of also dealing with is it's just because you test positive on that, it means you've been exposed, means you've developed some antibodies, but we're not sure how long those antibodies may protect you or if they protect you at all. So that's part of the other side of this. So you see a lot of this is being done concurrently with some of the testing going on. But right now, the methodology of testing that we're using, because we're in active infection rate right now, is to detect infection.
Follow up, Mr. McDonald.
Thank you, Mr. Chairman. So if I understood you right, Dr. Martell, right now our primary focus is in today, people currently infected, to make sure we accurately identify those who are infected or maybe not be infected. Is there a plan to hopefully quickly start looking at the future and how we can work our way out of this instead of just being focused in the today?
Well, we currently, you know, and I know that's hard for everyone to understand because it feels like we just got another kind of kick, right? Is that we are constantly planning for the recovery, right? Which is, you know, kind of it's always like, I always said, when for those of us worked in hospitals, always discharge plan. And as you know, in emergency response, the minute we go into response, we begin to take a look at how do we come out of this in terms of recovery. And you know, the debate in this nation is the way that we're going to get out of this really probably is to make sure that we have a vaccine. So that has been a lot of the work and focus. So as we move forward, part of it is that's why as we start to resume these kinds of levels, we've done doing contact tracing and contact investigation was kind of out there. A lot of you keep hearing about this with aggressive testing and then contact tracing. So for when you look at our daily report and you see that there are over 2,000 tests have been done, every single one of those has been contacted, first of all, to make sure that they are isolating until their results come back. If they are positive, then we are working through all of the immediate contacts, which is how we've been able to identify you're starting to see some things like who are they involved with in terms of a workplace, family members. And so that's the aggressive management that they're talking about is we've got to be able, when we start coming out of this, is that we're able to quickly identify when there's an outbreak, an infection, and begin that very aggressive containment piece. And we have been working all along on this. You're right. This concern is that this is probably that there's a period of infectivity before you have symptoms, which is why masking now is becoming the recommendation whenever you are out in public.
You had a follow-up, Mr. McDonald?
I promise this is the last one. I apologize to the fellow board members. There are a lot of questions about testing. I know very early on it was very uncomfortable going back in the nasal. Are we still doing that type of testing, or has there been a more improved testing for the county?
Okay, so currently the gold standard, I'm going to call it, is the nasopharyngeal swab. So that's the one that goes all the way back down your nose to the back of your throat, and you're supposed to get a nice gag and cough reflex out because of the way that this infection populates. And that can be used for both those people who are asymptomatic without symptoms and those with symptoms because it goes far back. The testing that we're going to be doing, and then it goes to what's called, we call it RT-PCR, which is the current, what we call molecular-based test to develop, for really looking to make sure that the DNA of that going on at that particular time. The testing that we're going to be doing with the National Guard is what's called they're using a nasal swab. That's why people that are symptomatic can only be tested using that, because it doesn't go as far back. It's more up front in the nasal passages so that you can then, it's not as uncomfortable for individuals. And obviously you can tell in long-term care facilities, we'd be very concerned about gag reflexes and things like this on some of that testing that we'd have to do. Ideally, as I said before, we'd like to get to, people probably have a better sense and want, again, to probably have a blood test. It would be great to get that antibody testing. But that aerosolized, when they have to do that specimen, that's when you see them wearing the big face shield coverings and all of that, because it aerosolizes. And that's why that's one of the highest risk procedures to be doing during this time frame. So we are using every kind of testing methodology that has been proven to the best of our ability today with the technology we have. The rapid test still uses what they call the nasopharyngeal swab that you hear that's doing by Abbott. The difference is those results get back in, a matter of, minutes, so they say. It is not as widely available, and but we do know that there are some that are starting that up as well. But it has some limitations as well. There's some dual studies going on about, is it as reliable as the PCR using the other reagent type test?
Any other follow-ups? Thank you, Mr. McDonald. Thank you, Dr. Martell. Mr. Arena.
Thank you, Mr. Chairman. Dr. Martell, the new infections that are showing up, is this all just community spread from an unknown source, or is a portion of it part of whatever contact tracing you're doing, and you can identify how the new infections are occurring?
Majority right now are, again, what we would say community. Now in a household, we've had some households. Definitely, we've got that contact. We've got some workplace contact investigations. And again, nobody's in deliberately, I said, we have had some interesting thing where the workplace has done a great job and then they all ate lunch together, right? Kind of forgot about the 6 at the lunch table. And again, that would be now community transmission. We initially identified in some of the years, but we've been able to kind of trace back on some of them. That's why when we talk about skilled or congregate living settings, those would be more what we identify. Once you've got one individual in that location, you can pretty much, because it's a household, you're going to be identified that probably we're going to consider that a location of concern and consider everyone. And that's why we get everyone into full PPE and they go into enhanced monitoring of all the residents in those facilities.
I see. Thank you.
Thank you, Mr. Arena. I got Mr. Girl.
Thank you, Mr. Chairman. Question for Dr. Martell. Dr. Martell, just your opinion and your thought and professional experience, what would happen if we open everything too soon without adequate testing? do you think that we'll have a second surge that will be even worse than what we are experiencing now?
Well, that is what the modeling suggests. And that's why there's been this kind of gradual, without a vaccine, right? So the problem with novel viruses, it gets a chance to mutate as well. So that's part of the concern. If you open up too soon and people are not protected, then you end up with a super infection and a second wave. And again, part of the thing right now is because people have stayed put. We went into shelter in place almost 6 weeks ago at the end of April, right? We went in mid-March. It did not overwhelm our healthcare resources. And so we can begin some resumption, as you heard today in the governor, of, and I don't like the term elective procedures, but that's what they're referred to. So they can resume some of that. If we have not done that, we end up with this tremendous amount of outbreak. We end up with a hospital system, again, not being able to respond to the number of people who need care. We're getting a growing positivity rate, which is, I share that, we want to make sure you all read the daily report. I know people probably try to avoid looking at bad news every day, right? But if you started out at the beginning of, the testing phase, maybe we'd have 3 or 4 or 5% positive. Now, when we're submitting, about 14% of our tests that are being submitted are positive. So we know we've got circulation of this infection out in the community. And there's growing concern, as we've all heard, about that you can transmit before you have symptoms, because some of the people that have been tested as part of either, kind of some of the work that's being done around surveillance testing in areas had no symptoms whatsoever that they would even relate to. So again, that's when you start to think about community transmission, and you can't tell by looking at someone, you can't tell by looking at their address, whether or not. And, as we get to outbreaks in essential service workers, this becomes very troubling because, again, at this point where people are staying put and we still have community transmission, that is very, very much a concern.
Thank you.
Thank you very much. I got a couple more hands up, but before I go, can you just take a minute, either Steve or maybe Dr. Martell, and just address, we had within our county apparatus, we had a confirmed case at River Bluff, and then we had a confirmed case within the jail. Can you just give a 1-minute hit on both, just so we get those two addressed to the whole board for contextual purposes, because I know board members get these questions. Do you want to take it, Sandy, or do you want to hit on
Sure.
those?
Let's start with, you've probably seen that the location of concern includes our Winnebago County Nursing Home, River Bluff. So in this case scenario, a staff member tested positive. So they become a zone location of concern. And the current recommendation as of now is that all the staff need to be tested. Now, the concern about that, of course, is, right now, every staff member is already being checked at the beginning and middle of their shift. So they come in, they're temperature checked, they have to do a symptom checklist, they're in personal protective equipment, then they're, again, so nobody's reporting illness. But that is the current recommendation that we are going through. So we are getting the process of testing individuals. Now, I want to be clear with everybody, though, that if we were to say, let's say I've already told you about 14% positive, if we test everyone on the same day, what would happen? We have to also be careful of, do we have adequate staffing levels, and could we get adequate staffing? So I know that everyone's concerned about that. So we've been doing a phased approach. We've got a plan to get everyone tested. Through River Bluff, we've been in partnership with our wellness center and using Illinois Department of Public Health for the test kits, so that we can make sure that we've got that under wraps. Everybody is still continuing being. We're also enhanced monitoring of all of the residents. But that's the kind of level of work that goes in. In the corrections, we've had several individuals that came in, were booked. The jail has a very extensive cohorting process. So in that case, it's not the staff, it's the patient coming in, we'll call them the detainees. And in that case, there's a very extensive process that the corrections team has in place to cohort new people coming in. So if I'm booked today, I'm not put into general population until I've gone through an incubation period of 14 days and have not developed any symptoms. And then there's another period where they do another kind of cohorting so that the individuals currently in the system who are not exhibiting signs of COVID are not exposed to someone coming from the outside community. We've tested individuals who've bonded out, and then we follow them in the community until their test result comes back. And if they test positive, then we also are following them through that process as well and isolating them, depending upon the circumstances that they've returned home to. We do have alternate housing capabilities to be able to house individuals that might need that kind of care during that time frame. They do not need hospital care. I want to be clear with everyone. These are people that if they had a home to go to, they would go to a home. But for whatever reason, and maybe sometimes they have an order of protection not to return to that home, so we have to put them someplace else until we can make sure that they are COVID-free and can return to the community fully without any isolation going on. Does that explain it?
Yeah, thank you very much. Do we have a chief deputy on the line? Anything on the jail real quick? I've had a lot of questions on that.
Yeah, I just to follow up with Dr. Martell said, there was a corrections officer that tested positive. However, the facts around that case are that the corrections officer has been off work since March 5th on an unrelated medical issue. So that person did not have any contact, for almost 7 weeks, and has not had contact. In addition, has not had any contact with physical contact with any other jail staff. So in this case, we're confident that there's absolutely no transmission from this person to the jail, either the inmates or to other staff members.
I would just add, because the congregate setting, the jail, these are things under our direct, I guess, control through our, elected official with the sheriff and obviously our department head. There was a very prominent local official made a comment recently that just now that the state and local health department is starting to do something related to nursing homes. The protocols that were in place, a month and a half ago, even at River Bluff, absolutely in line with IDPH and any CDC regulations. They're literally temperature checking staff and patients twice a shift. Everything that should be done is being done, and it's to the credit of their staff and their leadership there. On the sheriff's side, the feds were in, I believe, taking a tour, and I think their comment was that no jail that they've been in recently has been more on top of the COVID preparation game. So thank you very much on both fronts there. Everything that can be done is being done. The testing on River Bluff, the sheriff's department is doing as optional testing as well. So we're doing everything we possibly can. Thank you, Dr. Martell, as well on the commentary there. Any other questions? I know I had a couple of hands up, and I'm sorry. Oh, go ahead, Dr. Martell, then to Mr. Webb. Sorry about that.
First of all, I want to be, everybody, as we rapidly evolve and learn, think about what we knew in January, what we know today, right? First of all, everyone went through aggressive making sure that people were not reporting to work ill, right? We started that long before all of this. And I have to say that we have to really support emotionally the staff that are in those facilities, whether it's corrections or whether it is in the nursing homes and skilled facilities in River Bluff, because they are under a tremendous duress, I'm going to call it, outside of their usual job routines, because there's fear, right? I mean, once you get into a location of concern, there's kind of this view that who brought it in? Could you notice anybody? And nobody is intentionally exposing anybody in these locations. And they are, I mean, literally, working more than you can ever imagine, trying to keep it, make sure that they're doing everything perfectly, right, making sure that every resident is protected, every, detainee is safe in there. And again, I come back and say, if you ever have a question about what their procedures are, please don't hesitate to ask, but, understand that they are really working diligently to not make sure that their populations are protected, and the staff that's working is also protected.
Good, thank you. Mr. Webster. Can't hear you, Mr. Webster. There you go.
All right, one final, I don't need the answer now, but I would like to know. In our county, I would like to know really, these deaths, we don't see it all the time. I would like to see the age, sex, race, of people that have, succumbed to this. I'd like to see this in comparison, our, most populous county, which would be Cook County. I'd like to see a comparison, percentage-wise, about these various groups of people that have died. And if you could come up with that for me, I'd be most appreciative. Thank you.
Thank you, Mr. Fellers.
Thank you, Mr. Chairman. Dr. Martell, thank you for all the work you've done. I've got one question. It's been reported to some degree that health departments are concerned that the coronavirus will still be spreading when the next flu season hits. Are there contingency plans for treating both a flu outbreak and a potential corona continuing to circulate at the same time?
Of course, we're looking forward to that. Here's the positive side on that is, of course, we will continue to encourage everyone to be vaccinated against flu, right? And many of the same containment procedures are used, right? It's a respiratory pathogen. We use very much the same. The concern will be, will we know the difference between the two? And that's why the vaccination becomes essential for the population. And for anyone who knows, anyone who isn't vaccinated, we already had recommended healthcare workers mask. That will continue. The good news has been with flu, at least we have antivirals, right? Seasonal influenza, we have an antivirals that we typically can use that can shorten the duration and lessen the complications. But again, like everything else, it just adds another kind of nuance and another, I'm going to say, level of complexity. But again, we will continue to encourage, and of course, I will want all of my county board members to vaccinate, as well as take the necessary precautions when you're out in public masking.
Okay, thank you, Mr. Fellers. A follow-up?
Actually, no, I just realized this is just for the help desk. It looks like our YouTube feed might be down. Just wanted to get a heads up.
Yeah, that's why I'm on my phone. Yeah, I couldn't get into the feed.
Thank you.
I don't know. I don't want to violate any Opens Meeting Act laws if our feed out to the public has gone down.
Okay.
Okay, we're looking into it.
Thank you very much. Any other questions? And we have Ann Johns there. She's been doing some of the helping the EOC logistics team on PPE orders. What she has is a snapshot of the really incredible volume of ordering that has occurred to date. As we've talked about 2 weeks ago, if we want to provide an update every week, then we would ask to be on, let's say, the Finance Committee agenda for a quick update, and then we can do a longer brief at the board meeting. Whatever works, we're comfortable with. But the initial thrust we have laid out. And you want to just take a few minutes? We probably are running short on time, but could you give an overview of where we're at from a purchasing standpoint? Keep in mind, these are items that we will be reimbursed for in many cases by partners. It could be a long-term care facility. We've had the ability to get PPE from the state and other folks in ways that individual organizations would not be able to. So if we didn't get it for them, they would be out of luck and there would be a lot of risk. We believe that we're going to have a reimbursement from individual partners that are, for example, for-profit long-term care facilities. Others would be coming from IEMA or FEMA. There is a very strict accounting process, but Ann can take you through this. And then if we want to have follow-up, if we start to run long, we could always kick that to a Finance Committee meeting. We can do as much detailed discussion as you want, but we may not go on and on and on it tonight as we got an agenda, but just want to introduce it. Ann, are you there? Ann, you there?
Can you hear me?
Yes, I can. Go ahead.
Okay, good. Sorry about that. I don't know what happened. Well, thank you, Chairman. Did everyone get the one page from you? Did everyone get a one-page document that says PPE purchases and services?
I got it from you just prior to the meeting, and I forwarded that on to the entire board.
Okay, if everyone has that, it'll be easier to discuss it. But basically, I wanted to get it just like a snapshot in time. So this is current as of 4 o'clock this afternoon, and today we did a lot of purchasing. Basically, the logistics chief over at the EOC contacts me and says, we need face masks, or we need this, we need that. And then I go out and source it as reasonably as I can, but also with timeliness as well. And if I can get it locally, I definitely try to purchase locally with our local vendors. So this is just an example. This is what we're currently buying, and everything in this first column is PPE, not the sign language, but everything else is PPE equipment. And this is, and the next column is what we have spent as of today, or we're obligated to. We have purchase orders out. Can everyone see that? Any questions? And then the third is just what I want to. The third column. I didn't want to overwhelm you with numbers, but the third column is an example of what the PPE amounts that we receive for, let's say, gloves. For 16,500, we received roughly 170,000 gloves. Our PPE weekly burn rate is 106,000 gloves. So you can see we're going through a tremendous amount of gloves. And this is based on 94% reporting. And what I mean by 94% reporting, that's 94% of the agencies, the long care facilities, the law enforcement, first responders that have told us what their burn rates are. So gowns are our most expensive item, it seems, and the most critical at times. And procedure masks is our next critical item. And these items are based on our needs today. The PPE burn rate that you'll see in red, those are our numbers as of this week, today. Now, next week or the week after, if we have more cases, more issues at more facilities, then those numbers are only going to go up. So before Milestone, let's say, had a case, we wouldn't have been providing them with any equipment. Now that they have cases, we're providing them with supplies. So you can see how it just multiplies. And at the very bottom, I give you a little synopsis of who we are providing PPE for.
And for those who don't have the document in front of them, there may not be, I'm sure some would not be able to print out. We are talking about a total of 572,000 and change has been, has been invested in PPE and other related items to date, a significant amount of money. And again, there's an accounting system for reimbursement from many of these agencies to FEMA and IEMA. We are going to blow by as a community. This is not the only PPE being ordered. Hospitals have a lot of networks, a lot of the long-term care facilities, a lot of the public and first responders have networks. But when there's a shortage, they've come to us, and you can see by the sheer numbers, there is a shortage. And without this, you would have first responders, long-term care workers working without the basic things they need at a time when everyone in the country is saying, don't do that at the professional or public health level. It's an unfortunate reality. This is the longest our emergency operations center has ever been open in the history of our community. It's, these are very weird times, but again, this is the update. We can manage updating and conversations going forward as we want to on any interbill that you want. But we wanted to get this in front of you. The number on PPE that we needed to get going was a tremendous thrust to get out the gate. The testing facility, for example, at the U of I College of Medicine, we are getting a lot of state help direct that does not reflect here. However, tents, there's a number of things that go into that site. But you also have 80 members of the Illinois National Guard who are providing service that doesn't show up in something like this. So this is a picture, a part of the picture. It's a very direct picture for us. With that, I would open it up to any questions. Any hands up? I see Mr. Kelly, then I see Mr. Schultz. Mr. Kelly. Go ahead, Mr. Kelly. We can't hear you. You're on mute, Mr. Kelly. Bottom left-hand corner.
Unmute him, Dan.
Oh, there you go. Go ahead, Dave.
Okay.
Go ahead.
Yeah, I'm sorry. How are we going to pay for it? Where are we going to get the money? Host fee? What do you think?
Sure. I'll turn, in terms of which fund it comes from, I do know Ann has been using our purchasing cards. I can't go into fund balances on that. I would defer that to Steve and finance. But at the same time, I do know we have a number of options, and that how we do that is fine. To date, we've been paying things as we go, and that's where you see what's before you right now. I'm not sure what the purchasing cards are tied to general fund. I'm not sure. I do not believe it's 1%.
Yeah, I think Steve would be the best one to answer that question.
Yeah, Steve, you there?
Yes, right now we are accumulating the expenses in a grant fund that we have just to keep track of the actual expenditures. So come the time in the future when we can get the reimbursements that we need, it'll come out of that. But, it's really the cash flow item, to be honest with you. Ultimately, if this thing isn't over with by October or the end of our fiscal year, then we're going to have to determine which fund we take the expenses out of. It we probably end up setting it up as a receivable based on the fact that we're going to get the money back. But at the same time, it's really a cash flow item right now. We're spending money that that's going out the door.
Mr. Kelly, do you have a follow-up? You're
No,
on.
I guess that's enough.
Kelly Schultz.
Yeah, thank you, Mr. Chairman. Just if we could in future reporting also get the amount that's been reimbursed to date, that would be very helpful.
We'll add that. That's a very good point. Any other questions on what Ann shared? I see a hand up. Mr. Arena.
Thank you, Mr. Chairman. Just to make sure I understood correctly, you're expecting that some of this money will be reimbursed, or maybe most of it, but maybe not all of it. Is that correct? Or all of it will be reimbursed?
In discussions with Chief Bergston and the Emergency Operations Center, we are on a pace where we're going to be past, we're not going to fall short of the threshold to put in for reimbursement from the state or federal level. Like we did with the flooding. Some of you remember last spring we declared a disaster. There was certainly a disaster, but as a county, we did not spend a lot of money, so we couldn't even put in for the little bit we spent, and that fell on us. In this case, we are going to be well above the threshold to put in for reimbursement, and we expect to get nearly all of the money that we can't get reimbursed from partners back. If there's any new information that I get on that, I will share it immediately with Steve, with the finance department, with you. But that is what we believe to be the case. That is what we are being told. There's communications between IEMA, the state level, and FEMA. But then specifically, so for example, if a private nursing home or private long-term care facility is in a scramble for masks, we give them 10,000 masks. They are going to get a bill. We spent weeks scrambling to get PPE. We had local manufacturers reconnoitering their operation to make shield and face guards. We invested weeks of time not ordering, but figuring out where we could actually get our hands on stuff, not just from the state, but even locally. And a lot of great work was done by other people. Now, this is not about me at all. But then we started ordering. And so there you see the reflection of that. But I am confident we are going to be being made whole or close to it. Could I be wrong? I could be. Things are evolving very quickly, but that is what I believe to be the case right now. That is what I'm being told by very credible people who are working this very hard. And if there's any change, I will find
if I can just say one thing, this is Ann. One of I do the purchasing from this end, but as a logistics chief at the EOC, there's a staff of 5 or 6 of them. 2 are at the warehouse, 4 are on site. They, with every order that we place, they turn around and fill out a state form for reimbursement. It's filled out in triplicate. That's right, paper triplicate. That's how we have to fill out the forms. So those are being prepared for every single item that we bought. If it's 100 masks or 10,000 masks, there's a form filled out for every meal that's purchased or whatever services. So we're working very closely going back. I try to go over there every day and spend a few hours making sure we have everything up to date. So when it's time to submit these, we will have the forms ready to go. And I just want to say kudos to, certain agencies and people are having a very hard time sourcing. They really are, but that's why we had to reach out to Interstate Graphics, for example. He's making face shields for us because he figured out how to do that. And we're very grateful because that was one thing we just could not get. And of the 13,000, he's made 10,000 of those. And his price is half the price of what we were paying for the others. So it's just a matter of that sourcing. In a lot of nursing homes or homes, they just don't have resources. They go to their regular supply and they don't have it. So anyway.
I'd follow it. I know there's a hand or two and we will get to you. So just going forward on this topic, if Mr. Salgado wants to slot in an update, and he can limit the time as much as or little as he wants. That way we stay on a weekly staggering of this. If he doesn't want to, because he's heavy on some other agenda stuff, that's his prerogative, but we're willing to have the updated conversation on this. Things move quickly within a day at this point. So whatever it needs to be, and if you have other ideas on that, we're game. Did you have a follow-up, Mr. Let's see here, Mr. McDonald, then Mrs. Crosby?
Thank you, Mr. Chairman. I have no doubt that the threshold will be met for this incident. My concern is the fact that the county wasn't in terrific financial shape. The state was even worse. Will there really be funds at the end of this to give us any kind of reimbursements for our expenses? I would strongly encourage purchasing, the chairman's office, finance. Let's make a contingency plan for just in case we are not reimbursed. How are we going to move forward 21 and 22 and 23?
Thank you, Mr. McDonald. I think that's a good idea. I do want to say one thing as far as reimbursement. I do worry about it as well. But what I understand is IEMA is going to be our facilitator with FEMA to get reimbursed. So they're going to help us. That's why these forms are for them. And then they will facilitate with FEMA. So let's hope the feds have a little bit more money than the state has, because that's where it ultimately will come from what I understand.
There's 2 parts to the feds. One is the emergency, the FEMA, IEMA stuff that we're talking about right now. The other part is coming in the next month, hopefully, knock on wood, is that now that the Congress took action today for like a 4th time, there's going to be, I don't know, another stimulus package that will look at local government. And we're going to have to get it. That is a separate thing. That is about Steve's $6.5 million revenue and fee shortfall that he talked about with the finance committee. There's going to be some stimulus money coming to local governments with any luck if Congress takes action on that in the month of May. We are going to be aggressively putting ourselves out there for that. I know everybody else will too, but we will be very much aggressively having that conversation, but there's 2 separate parts. I know there was another hand up, or I believe there was, Yes, Mrs. Crosby. Go ahead, take yourself.
Okay, thank you. I personally want to congratulate Ann Johns for her workmanship. When she went through River Bluff Nursing Home and was counting walkers, I knew we had a home run. She has a great work ethic, and her transparency on this issue has been exceptional. And I think we all should personally thank this gal for her due diligence and her willingness to dig in and find the details that we need to know. So thank you, Ann, for all you do.
Well, thank you. That's very kind.
She's been a great connection with the EOC on the logistics side. Any other quick questions on this topic? I saw one other hand up. Mr. Kelly again. Go ahead, Mr. Kelly.
Thank you, Chairman. Just wanted to I forget what I was going to ask.
Oh, that's okay. That's okay. We'll come back to you if we need to. Anybody else? Okay. Just real quick, the priority on PPE that as it stands now is long-term care facilities first when we can fill a need. First responders in the county, not just Winnebago County, not just City of Rockford, but as others need it and to the degree we have it. Other county operated testing sites, and then publicly funded like mission critical partners like corrections, the coroner. Obviously that's very important, and we'll make sure they're covered the very best we can as well. I know we're running very long. I think we had a lot of board member questions individually. We wanted to get that caught up. It won't be like this when we have future COVID updates. We'll take it in a little more chunks. But I do appreciate your giving us some time to share some information with you. We won't get to it tonight because we're running out of time, but the governor did come out with a major update on extending the stay-at-home order, and it involves a number of pieces. We probably don't have time to get into that, but there is some relief for small business. Not as much as some want, but some relief around curbside for non-essential and delivery for all businesses can do that. It addresses the garden centers, which was a huge issue. Garden centers do 50 or 60% of their business in the month of May with Mother's Day in the spring. They're going to have some opportunity to get back in business. I believe they addressed elective surgeries a little bit in the order as well. There's a new emphasis on masks. We'll lay it out or follow up, and I don't mean to cut anybody short on that. This is a big deal, but I know we're running really long on this tonight. We got to actually get to our official agenda. So if it's okay, we won't spend time on the governor's order. We won't spend time on what Congress did. It could be a follow-up in some emailing as we go forward. But I do appreciate the opportunity to update you guys on stuff. With that, is there any board member correspondence? I don't see. Oh, yes, sir. Mr. Billick, then Mr. Booker. Mr. Billick, you're on mute, sir.
And I've been thinking about it the whole time. Anyway, thank you, Mr. Chairman. I'm just mentioning I wasn't here for the attendance, so I just wanted to make myself aware for that one.
We'll make sure that we get you marked down as present. Thank you very much. Got the thumbs up from Clerk Gummow. And then I think Mr. Booker had something he wanted to add. Mr. Booker?
Yes, thank you, Chairman. I'm just having a really tough time with the latest decisions by our governor, making the decisions that have been made in regards to the good of the people. Every level of government, the number one responsibility is public safety. Recently, when the governor released 1,000 comments in a review board, and opposition from the Illinois Sheriff's Association, the Illinois Chiefs of Police, the Fraternal Order of Police, they sent letters to the governor and advising against this action. At this time, he's still the issue. We were led to believe that it would non-violent convicts, and I bookered us and released is one of these individuals has already posted up on Facebook and using his street name. So again, it's something we all need to be aware of. No accountability for their parole. Can you imagine being a victim or a witness that testified against this person? How do you think you'll sleep at night? Is it a public safety issue? You bet. And now he's looking to China for supplies, and I just looking to Russia for supplies during the Cuban Missile Crisis. So again, his decisions lately have caused serious public safety issues, and I call what they say bovine excrement. That's all I need to say. Thank you, Chairman.
Thank you, Mr. Booker. Any other comments by board members? I do not see any hands up, so we'll move on. I don't have anything. We took an ample amount of time in the update on the COVID stuff. I just want to thank you again for your time on that this evening. Announcements and communications, Clerk Gummow. Go ahead and mute yourself, Lori.
Sorry, I was trying to use the space bar. The items received below were received as correspondence, Mr. Chairman.
Okay, we'll go ahead and place those on file. Thank you, Clerk Gummow. And can you just real quick give the timeline for when the 2 recounts will be officially communicated to the community is over with official results from the 2 contested or challenged races? One was a county board seat. The other one was in the Republican side of the state's attorney race.
Yes, Mr. Chairman, we had received 2 requests for discoveries, but that does not change our vote or any of the information that we have reported to the State Board of Elections. That does not change the results at this time.
Thank you very much. We'll move on to consent agenda. May I please have a motion to approve the consent agenda, which includes 3 items: raffle report, bills, and approval of March 19th minutes. Motion by Mr. Billick, second by Mrs. Crosby. Any discussion? Seeing none, are there any board members who oppose this motion? I do not see any or hear any, so I will ask the clerk to cast a yes vote for all members present. Thank you very much. With that, we'll move on to the county administrator's report. Steve.
Thank you, Mr. Chairman. I have nothing to report tonight.
Okay, thank you very much, sir. We'll move on to our next item of business. Anything from department heads quickly? Don't hear or see anything there. Standing committee reports. I'll go right to Mr. Salgado. Mr. Salgado.
Thank you, Mr. Chairman. We have one item, which is a budget allocation amendment 2020-018 STARCOM cost to be laid over, but I'd like to suspend the rules and just get it out of the way.
All right, thank you, sir. We got a motion by Mr. Salgado to suspend the rules. May I have a second? Looking at Mrs. Crosby on the second. We got a motion, a second to suspend the rules. Any discussion on suspending the rules? Seeing none, are there any board members who are opposed to suspending the rules this evening on this item? Seeing none, we have suspended the rules. Mr. Salgado.
Thank you, Mr. Chairman. So I'd like to move to approve budget amendment allocation amendment 2020-018, the STARCOM cost, and I so move.
Got a motion by Mr. Salgado on budget amendment 2020-018 STARCOM. May I have a second? Mr. McDonald on the second. Item is now before the board for discussion or questions. Any comments or questions by board members? Seeing none, are there any board members who are opposed to this motion? I see none. We will cast a yes vote for all members present, and it's a unanimous vote. Thank you very much, Mr. Salgado.
Thank you, Mr. Chairman. That's pretty much our report. Just one thing, we're looking at, once again, the different projections for next year's budget and our current budget that we're in. So just hopefully we'll get more information on that. I know that Mr. Chapman provided some good information on last finance committee to kind of talk a little bit about that and where our shortfalls would be, anticipation. So more to come on that. And yes, we will take into account and John's information. We'll allot some time to kind of go over the PPE stuff, information, because obviously it's good information for everybody to be aware of. We'll continue with that. Thank you, Mr. Chairman.
Okay, thank you very much. We'll go to zoning, Mr. Webster. Oh, Mr. Webster, oh, he's back. Mr. Webster, you're up.
There we go. Okay, yeah, everything's laid over once again. It was interesting to hear when Dave Tassoni said that we have to have a in-person meeting for some of our highway things. And so that's the way we should be doing it for our zoning as well. Zoning and highway both are kind of unique, that a lot of things we deal with mapping and maps and so forth, and there's a lot of visual involved. So I would prefer just to lay this over once again, and hopefully the next meeting we will have will hopefully be the first normal meeting we would have before our next board meeting.
Thank you, Mr. Webster. We'll move on then to economic development. Anything from you, Mr. Billick?
We have no report today, Mr. Chairman.
Thank you very much. Operations Administrative Committee, Mr. McDonald.
Thank you, Mr. Chairman. We have one resolution awarding landscaping and ground maintenance services, and I so move.
Got a motion by Mr. McDonald on the resolution awarding landscaping ground maintenance services, second by Mr. Crosby, second by Mrs. Crosby. Any discussion or questions by board members? I do not see any. Are there any board members then, if we take a vote, opposed to this motion? I do not hear or see any opposition, so I will ask the clerk to cast a yes vote for all members present. Motion passes unanimously. Mr. McDonald.
Thank you, Mr. Chairman. I do have one more piece of information. The actual contract for this bid wasn't put through to the operations committee. I know there was some discussion about that. In the future, if we could please make sure, in addition to the bid packet, if we can also get a copy of the contract. That concludes the report. Thank you.
We will note that. Absolutely. Thank you, Mr. McDonald. Public Works Committee, Mr. Tassoni.
Thank you, Mr. Chairman. About time here. Had to wake up from might have spent off a little bit. But, you know, and first here on behalf of your Public Works Committee, I'd like to just say, kudos to our health department, our coroner, our emergency operations center, and what's going on there, and everybody throughout the county that's putting forth a monumental effort in wake of this pandemic that we're going through. And just like to say, wish everybody and their family and friends to stay safe and healthy. And with that, your Public Works Committee this evening has at least, I think, about 8 or 9 items. And I'm going to try to take about a 20, 30-minute presentation and put it into 8 or 10 minutes or less, if you guys would all indulge me. First item on the agenda would be I would like to, there's a couple of things that here are attached to each other. They go simultaneously with each other. And I'd like to move to approve resolution 20-1-010 along with 20-011. They are resolutions that speak to cost sharings with Roscoe for the improvements of Willowbrook Road, and I believe up there at Rockton for the improvements on the intersection there. The first is authorizing the execution of an intergovernmental agreement between the County of Winnebago and the Village of Roscoe for the purpose of completing a traffic intersection design study for the intersection of Roscoe Road and Willowbrook. And the other is, the first one is the intergovernmental agreement, and the other is for the engineering services with Fair Graham of the appropriation of the MOT funds, and that is resolution 20-010 and 20-011, and I would move to approve both of those items.
We got a motion by Mr. Tassoni on items 2 and 3 on the Public Works Committee list, 2020-010 and 20-010 and 20-011. May I have a second? Mr. Kelly on a second, and Mr. Neighbors, thank you. Item is now before the board for discussion or questions.
And if I could, Mr. Chairman, the total cost is 38,200. It's a split 50-50 cost between Winnebago County and the Village of Roscoe.
Thank you very much. I think I saw Mr. McDonald had his hand up. Mr. McDonald.
Thank you, Mr. Chairman. Yeah, I did have my hand up. Both these, it says for a study. Do we not have resources within the county to do the study that needs to be done instead of spending 38,200 on the outside of the county?
Well, I believe that the 38,000 is the total cost of the project. There's some engineering design there, and I would ask Mr. Carlos Molina to offer some additional detail to that.
Carlos.
Yeah, thank you, Mr. Chairman. Mr. McDonald. Yeah, we do have people capable of doing that study here. However, they are right now at the moment very busy with other projects. We are doing designs for several projects that we want to put out there. That is the reason why we're asking for Fairground and Associates to do this, to be shared with this Village of Roscoe.
Got it. Thank you. Any follow-up, Mr. McDonald?
Yeah, thank you, Mr. Chairman. I think infrastructure is the number 2 thing that the county can be relied on to do, or number 2 expectation from people out of the county. I think it's something very important that we do. I'm also very worried about our financial situation, a lot of the unknowns, the shortfalls we're looking at having. I'm going to vote no on this tonight just because I think we should work within our budget and save the dollars that we can. It doesn't mean I'm against infrastructure improvements or anything like that. We just need to work at a pace that's consistent with our income.
Got it. Can I just ask a follow-up? Now, you raised a question, just for my understanding. This is technically within budget, but it's work being done outside the county, but it's not a budget amendment. If I'm saying that wrong, Steve, or anybody, correct me.
If I may answer that, that is within our budget.
Okay, but okay, then it's work done outside the county that would be, okay. All right, is there any other questions on, any other questions by board members? Yes, sir, Mr. Tassoni.
Thank you, Mr. Chairman. And I would like to say that these are budgeted costs, and some of the design studies and engineering costs incorporated throughout the year are budgeted items. So there's 2 or 3 different engineering firms that we use throughout the year, and they are budgeted costs. This is not outside the realm of what we expect to do. And like I say, this has been on the docket for quite some time, and is what we are looking to approve and move forward with. Thank you.
Got it. Thank you very much. Any other questions? Oh, yes, sir. Mr. McDonald on the follow-up. Yes, sir.
Thank you, Mr. Chairman. Just checking with Mr. Chapman or Mr. Molina as well. I apologize. If I understand right, we used to have roughly $500,000 per month from motor fuel tax funds. And last month it was down closer to 300,000 and it's expected to possibly go lower than that. Is that accurate?
If I may answer that, for the month of March, we did not see much of a change. We do get about 500,000 with the new 19 cents, motor fuel tax. We get about 520,000 per month. For the month of April, we will not know until like the 10th of May. But if people are driving 50% less, we will see $250,000 less on motor fuel tax.
Thank you, sir. Thank you. Yes, Mr. Tassoni, and a follow-up.
Yeah, thank you, Mr. Chairman. And just to let the board know and others, I have had some discussions with Mr. Molina as of lately. And like I say, when our new revenues come in, roughly around May 10th, somewhere thereafter at our next board meeting from there, if we could ask for an update as far as what the projections may be and see what kind of situation we are in at the highway department. I appreciate that.
Got it. Thank you very much. Any other questions or comments by board members on this, on these 2 items? So we have a motion and a second. Are there any board members who are opposed to these 2 items? We're going to ask the clerk to cast a no vote for Mr. McDonald. Are there any other no votes on this item? Nope. So we'll cast a yes vote for every other member present. Motion passes. Mr. Tassoni.
Thank you, Mr. Chairman. Next item on the agenda is Resolution 20-014, and it's a resolution authorizing the award of a bid for culvert replacement on Montague and Kishwaukee roads, and I would so move and speak to it as well.
So we have a motion. We have a motion by Mr. Tassoni. May I have a second? May I have a second, please? Second by Mr. Kelly and Mr. Webster and Mrs. Crosby. And just to clarify, that is over items, what number, what, just to be clear for the record.
20-014.
Got it. 20014 is the item.
Yeah, correct.
Correct.
And as to speak to this, this is an item that was budgeted at, the bids came in at 168,000. It is for the repair of a roughly a dozen different culvert replacements on Kishwaukee roads and Montague Road. And the bid was awarded to Intrac of Rockford.
Got it. Okay. So the item is 20014, culvert replacement, and it's before the board. Any discussion? Seeing none, are there any board members who are opposed to this motion? We're going to post a yes, or excuse me, a no vote for Mr. McDonald and a yes vote for all other members present. Motion passes, and that's 20014, number 6 on your list under Public Works Committee. Motion passes. Mr. Tassoni.
Thank you, Mr. Chairman. Next item on the agenda is Resolution 20-015. It's a resolution authorizing the execution of preliminary services agreement with Willett Hoffman and Associates for the appropriation of MFT funds for the completion and contract plans for culvert repair on East Riverside Boulevard, and I would so move and speak to it as well.
Yeah, we got a motion by Mr. Tassoni on 20015, resolution related to East Riverside Boulevard. May I have a second, please? Second by Mr. Webster, Mr. Kelly, and Mrs. Crosby. Item is now before the board. Any discussion or questions?
Thank you, Mr. Chairman. This item is for engineering and other services regarding the culvert replacement out on Riverside Boulevard there between Alpine and Forest Hills, where we put the road plates on last year. The engineering costs are $31,000, and hopefully in the near future, we'll get that set up for replacement as well.
Thank you. Thank you very much. Any other discussion? Seeing none, are there any board members who are opposed to this motion? Seeing none, we will cast a yes vote for all members present. Motion passes unanimously. Mr. Tassoni.
Thank you, Mr. Chairman. Next item on the agenda is Resolution 20-016. It's a resolution authorizing the award of bid for township seal coating. I would so move and speak to it as well.
Motion by Mr. Tassoni on 20016, number 8 on your agenda on the award regarding 2020 Township Seal Coating Program. Second, please. May I have a second? Mrs. Crosby on the second. Thank you very much. Item is now before the board. Any discussion by board members or comments? Mr. Tassoni.
Yeah, thank you, Mr. Chairman. This is typical on an annual basis. These are just pass-through funds. We administer the dollars and funds to administer the seal coating for various townships. And we just administer the funds, no cost to the county.
Got it. Thank you very much. Any other discussion? Seeing none, are there any board members opposed to this motion? I do not hear or see any objection, so we will ask the clerk to cast a yes vote for all members present. Thank you very much. Number 8 passes. Mr. Tassoni.
Thank you, Mr. Chairman. Next item on the agenda is Resolution 20-017. It's a resolution authorizing the award of bids for Perryville Road patching from Daimler Road south of Harrison Avenue. And just ask for a little direction on your part. I would first so move that item, Mr. Chairman.
You got a motion on that item on 20017. Resolution rejecting bids. So there's a motion to reject. I would take a second to reject. I think I see a hand up, Mr. Girl, on the second, and it is a motion and a second to object to this bid. So I guess we're taking a vote in a second to not accept something.
Correct, Mr. Chairman, and I would ask for you on the end of us to clarify the yay or nay vote. But basically, this was for road repairs out there on Harrison or Perryville Road. And the bids came in all over the place. There was some extremely high, some extremely low. And I think the county is tightening their scope of work and doing some other things so that we can dial that down, get it a little more affordable cost and get it to where it makes a lot more sense. And I'd just like for you to, like I say.
So a yes vote, thank you, Mr. Sony. A yes vote is going to reject. A no vote would a vote against rejecting. It doesn't pass it, but it just doesn't reject it. It just keeps it right in front of us, I guess.
And there again, on behalf of your public works, we would ask for a yes vote to reject.
Yep. And so I believe it was a recommendation of staff and the Public Works Committee to vote yes to reject, so they can go back and do even better in the second round here and come back and it'll be in a better position. So are there any board members who oppose rejecting this bid? Seeing none, we are going to. Yes, sir, Mr. Kurlinkis.
I could. Probably the proper one would be to reject all bids, not just this one. And if there are more than one bid, you should reject all the bids.
Okay.
So we'll clarify for administrative purposes, and that's a fair point. We're rejecting all bids. This is a rejection not of one, but all bids to date in this process. So if you vote yes, you will be rejecting all bids, and we'll make sure we get that in the minutes as well, so that we're all on the same page. Mr. Tassoni.
And just for technicalities, Mr. Chairman, I would move to reject all bids related to 20-018, or yes.
Yes. So we got clarification on the motion that would absolutely fall under a friendly amendment, I guess.
And that, I'm sorry, that's not 018. That would be the past one, 017.
Yep, 017. So we are rejecting all bids in this vote. And then we're all clear on that in the process, correct? So are there any board members who are opposed to rejecting all bids? I hear no objection. So we've rejected all bids in 20017. Thank you very much. We'll ask the clerk to cast a yes vote for all members present. We've rejected. Mr. Tassoni.
Thank you, Mr. Chairman. Our final resolution on the agenda is item 20-018. It's a resolution authorizing the award of bid for Baxter Road widening and resurfacing I-39 to just east of Mulford Road, and widening and resurfacing from Baxter Road in Winnebago County. And I would so move and speak to it as well.
Yeah, we got a motion. We got a motion by Mr. Tassoni on 20018 resolution around Baxter Road. May I have a second, please? Second by Mr. Girl and excuse me, Mrs. Crosby. Any discussion or questions?
Just, I would speak to that a little bit, Mr. Chairman. This bid for that service, this is like I say, tied to the $4 million bond that the county approved a month or so ago. And it came in at the lowest bidder was William Charles of Rockford, $3,383,000. We expect that to be a little bit under budget, and along with the things that go on with Kishwaukee Road south of the airport there, if those items come in under budget, we would look at financing that bond for less than the initial $4 million.
Gotcha. Understood. Thank you very much, Mr. Tassoni. Any other questions or comments by board members? Yes, sir, Mr. Fellers.
Thank you. I just wanted to bring this up again. I know that there are matching funds involved in this, but given the budget shortfalls that we have coming and the expenses that we have to put out there, I mean, do we really want to spend county money on a bond and all of this else on some project that may or may not be 100% absolutely necessary?
Yes, Mr. Tassoni.
Thank you, Mr. Chairman. I'll speak to it for a moment. If we need some more detail, we'll look towards Carlos Molina. But like I say, Mr. Fellows and the rest of the board, this was matching funds that, you know, without our involvement, we would lose those federal matching funds. And to cancel the project now, I'd say, no, that's not appropriate. That's not what we should do. But what we're looking at is to get these projects done under budget and return some of that money and finance less. And I would ask for Mr. Molina if you'd like to add to that.
Carlos?
Thank you, Mr. Tassoni. Yeah, there are $2 million from EDP funds that we would lose if we don't have this contract under contract by June 1st. So that is the reason why in the past we had asked for the bonds, so that we would not lose those that $2 million.
Mr. Chairman?
Yes, is that Angie? Mrs. Gorel, go ahead.
Carlos, isn't this a project that's been on the board for about 3 or 4 years now? This isn't a new project, is it?
It's not a new project. It is that is correct. And besides the EDP funds, we also have TARP funds. We have the Village of Cherry Valley who are contributing some money. We have some of the developers have put access fees towards this project. So it is not just the county. There is about 5 other agencies and funds that we're going to be using for this project.
But it has been on the books for some time, has it not?
That's correct, 3-4 years.
Okay, thank you.
Thank you, Mrs. Gorel. Mr. Feller's on a follow-up.
Yeah, I mean, I want to go back to this. We are going to be fine, even though that we would be losing funds, matching funds, we are going to finance more money at a time when we are already looking at a multi-million-dollar budget shortfall because of the crisis. And I'm going to ask this, we really want to be financing more debt, right? At a time we're looking, I get that we'd lose the funds. I mean, that's bad, but we're still financing debt, right? We are still borrowing money that we have to pay back interest on. And we're going to be, as Mr. McDonald said earlier, looking towards understanding like what kind of plans we might have in place to alleviate a $6 million budget shortfall. How are we, we really want to make this finance? I'm just going to ask the question.
May I also make another comment?
Yes, go ahead.
If I remember correctly, this is also an area where we have already shoveled dirt to bring in new industry, do we not? Isn't this something that we've been wanting to do to get that road upgraded? We have all these in here, and you mean that this money isn't already in the road budget to begin with? Is that money not already set aside for our share?
Can someone speak to that? Maybe.
I can speak to that. No, it's not. That's the reason why we had asked for the bond.
That goes into the bond.
Correct.
But is this not in the area where we need to improve that road so that we can get in more industry out there on Baxter Road?
That is the principle of it. That's why we got the EDP funds.
Because we're looking for new industry to come into this area. And that road had to be upgraded so that we can. We have a lot of traffic out there because we have trucks coming in and out all the time, do we not, in that area?
Absolutely. There's a
And
lot
that
of
road
truck traffic.
That road has to be upgraded so that we can also do more business out there. You're looking to bring in monies into this county, and this is how you're going to do it, because you build the road, they'll come. And we've got the shovel-ready dirt out there to be bringing in more industry. We also have the access to I-39, 90. We're in an excellent location out there, and so for economic development, we truly need to get this done. Thank you.
Thank you very much. Any other questions or comments? Oh, Mr. Girl. Then, I'm sorry, Mr. Tassoni, I skipped you by accident. I'll go to Mr. Girl and I'll come back to you. I apologize for going out of order there, sir.
Thank you, Chairman. I just want to say that these funds that are going to be repaying this bond are going to come from MFT funds and also bonds from the Public Works or other projects that are going to be coming up to date or that will be paid off in time. So this has no effect on any of the budget that has to do with the county as far as general funds or anything else. So this is all funds that are available and ready for the county to spend through the Public Works or through the highway system, sorry.
Thank you. Any other discussion by board members? Oh, Mr. Tassoni, I keep wanting to skip you. I'm sorry.
That's fine, Mr. Chairman. I appreciate it. I'm patient. And I would just like to say to the board here, you know, in hindsight, yeah, if we'd have known what was coming today, a year ago, or 18 months ago, maybe we would have taken a different approach to this. This is, in some aspect, the county's last hurrah, so to speak, under what we're going through here. It's what we've been going down the road for the last 4 to 6 months to get these two projects done. Like I say, we have the opportunity exists that we would lose millions of dollars in federal matching aids. This was approved by the board roughly a couple months ago. We're moving through with it. It makes a lot of sense. And this makes a lot more sense to me than what we've squandered host fees and monies from the landfill tipping fees on other projects with. So I would appreciate a yes vote on this matter, and let's move on with this. And from this day forward, yeah, it's going to get a lot tougher, and we won't be seeing these type of projects in the near future. Thank you.
Understood. Any other comments by board members or questions? I don't see any. Are there any board members who are opposed to this motion? I do not hear or see any opposition, so we will ask the clerk to cast a yes vote for all members present. Motion passes unanimously. Thank you very much. Mr. Tassoni.
Thank you, Mr. Chairman. And in closing, I would just like to say, you know, to all our board members and those that are on the sidelines and watching, you know, stay safe. I wish you all well. I appreciate all the hard work and effort you're doing. You know, hug your kids, take care of your elders and your grandparents and your uncles and aunts, and take care of your pets as well. Thank you.
Thank you, Mr. Tassoni.
I'm sorry to interrupt, but we skipped 2 items. We skipped item 4 and 5. We need to go back to those.
Let's move back to item 4 and 5 then. Excuse me, Mr. Chairman. Items 4 and 5, Carlos, where are they? You say items.
So
okay.
20012 and 20013 would be the 2 items.
I don't have them on my paperwork, so that's why we missed them. Anybody else got them handy?
So the item that Mr. Tassoni is referencing is number 4 under Public Works Committee, and that is 20012, the resolution authorizing the award of bid. For
I do have them. I'm sorry, I do have them, Mr. Chairman.
Yeah, go ahead and jump in there. It's yours.
I have them tied in. Okay, let me back up. Excuse me for that, but I guess we do. If I've skipped them, Carlos, thanks for reminding me. And basically, I will read them in together because they are tied together. 20-012 and 20-013. They are resolutions authorizing the award of bids for county general letting, and 20-013 would be the resolution appropriating the MFT funds to pay for those items, and I would so move.
Got a motion by Mr. Tassoni on items 4 and 5 on the agenda, 20012, 20013. May I have a second? Mr. Webster, Mr. Girl, Mr. Kelly. Item is now before the board for discussion or comment.
Mr. Chairman, if I could. Yeah, and basically this is an annual item, and what this takes into quantities and materials and things that the county uses on a regular basis as far as roadstone, chips, and materials. And basically there's a slew of different things that come in with the bids as far as the distance of travel, where they got to go, aggregates and things of that nature. They're tied together. And like I say, one is for the materials and one is for the appropriation of MFTs approving those funds. And that's it, unless Mr. Molina would like to add to them.
Carlos, do you have anything you want to add on the background here?
Yeah, thank you, Mr. Chairman. Besides the materials, we also, this is how we can get MFT funds to do what we do here. That includes the equipment that we purchase. That includes when our own guys are out patching potholes. We have to do this so that we can charge it to MFT funds throughout the year. That includes salt, paint, and all those other items.
Gotcha. Mr. McDonald.
Thank you, Mr. Chairman. I would just want to check with Mr. Chapman. This $8.5 million, is that what we budgeted? Is that in line with our budget?
I'm sorry. I guess I would ask Carlos that. I assume that's the number that's incorporated into the budget. So that what would be in the resolution.
If I may add to that, actually, to clarify that, This is again, what we need to do with the state so that we can appropriate the MFT funds. Because of the additional 19 cents that were added a few months ago, that was not originally budgeted. That revenue was not originally budgeted. So we were planning on doing that at a later date as a budget amendment for the revenue part of it.
Okay. Thank you very much, Carlos. Any follow-up on that? Yes, sir, Mr. Schultz.
Yeah, thank you, Mr. Chairman. Just as a curiosity item, we're dealing with obviously a huge amount of money in this process. So did the bid process come back with good results, Carlos? Were you pleased with the results of the bid process?
Yes, yes, I was. The prices are pretty good, and it pretty much matches what we had last year.
Any follow-up, Mr. Schultz? Okay, thank you, sir. Any other questions by board members? Yes, sir, Mr. Tassoni.
Thank you, Mr. Chairman. And just like I say, in layman's terms, and just trying to make this rhyme with something, as to the county's needs and what they do as far as materials and expenditures, this would be very similar to an office setting where you're buying paper, pens, and paper clips. This is what they do every year and their basic needs.
Thank you, sir. Any other questions or comments? Seeing none, are there any board members who are opposed to this motion? I do not see or hear any opposition, so we will then cast a yes vote for all members present. Motion passes. Mr. Tassoni.
Thank you, Mr. Chairman. That concludes our report. The next Public Works Committee is to be announced. Thank you.
And I want to wish you a happy birthday.
Oh, thank you. The big 5-1 today.
Today's your big day. Happy birthday to you, sir.
Thank you.
Public Safety Committee, Mr. Booker.
Well, I'll try. I'm getting about half of what everybody's saying. I keep getting this internet is unstable. Can everybody hear me all right?
Yes.
I hear you good.
Go ahead.
Public Safety Committee brings forward a resolution approving subcontractor. I have been talking.
Do you want me to read that one in for you, sir? I'm gonna, if it's with your permission,
You know what?
I'm gonna read it in for you. Is that okay?
Yeah.
Okay, I'm sorry, Mr. Booker.
Yeah.
Public
Thank you,
Safety
Chairman.
Committee.
No, it's not. I'm not working out here.
The standing in for Mr. Booker, there's a resolution approving subcontractor agreement for the Department of Justice, Violence Against Women, fiscal year 20, improving criminal justice responses to domestic violence, dating violence, and stalking program. With that, I would entertain a motion. I need somebody, Mr. Salgado is going to make the motion and Mr. Fellers is seconding the motion. The item is now motion and seconded and is before the board. Any discussion or comments on this item? I don't see any. And with that, are there any board members opposed to this motion? I do not see or hear any objections, so we'll cast a yes vote for item 2 under Public Safety Committee, and that motion passes unanimously. Item 3, again, standing in for Mr. Booker, a resolution approving subcontractors agreement for County of Winnebago problem-solving courts. May I have a motion on that? May I have a motion on that item?
So moved.
Motion by Mrs. Gorel, second by Mr. Salgado. Thank you. Item is now before the board for discussion or comment. Seeing no hands up, are there any board members who are opposed to this motion? Seeing none, I'm going to ask the clerk to cast a yes vote for all members present. Motion passes unanimously. Item number 4 under Public Safety, under Mr. Booker's committee report, resolution renewing the annual maintenance agreement for X-ray scanners. With that, I would entertain a motion. May I have a motion again?
Second.
I got a motion by Mrs. Gorel and then I'll take a second from somebody if you'll help me out, Mr. Arena. Thank you for the help. Motion and second on item 4 under Public Safety Committee. Any discussion or comment? Seeing none, is there any objection by board members to voting for this? Seeing and hearing no objection, I'm going to ask the clerk to cast a yes vote for all members present. Motion passes unanimously. Second to last, item 5 under Public Safety, under Mr. Booker's committee, resolution extending proclamation declaring the county of Winnebago, Illinois, a disaster area for coronavirus response. This would be our second extension. It is my understanding, or I'll take a motion on that, if we could motion that onto the floor. Mr. Feller's on the motion, Mrs. Crosby on the second. Item is now before the board. So it's my understanding by Dave Kurlinkus that this ends, the first extension ends on the 30th. The first extension ends on the 30th, and then it would extend for 45 days. Is that correct, Dave?
That is my understanding, Chairman.
Okay. So it'd be a 45-day extension. At any point, the board could come back and take action to stop, but without the board doing so, it would go to the end of the 45 days. Are there any questions or comments? Somebody jumped in. Mr. Arena had a hand up. I'm going to go to Mr. Arena first, and then we'll go to whoever had the second question second there. Mr. Arena.
I just wanted to say that I expressed some reservations about this to some of my colleagues on the board regarding how this affected how we were making decisions about closing businesses. And through the course of the day, I was able to get my questions answered and found that they're unrelated. And so I'll be voting in favor of this. Thank you.
Thank you, Mr. Arena. Any other questions or comments by board members? I don't see any. Are there any board members who are opposed to this motion? Seeing and hearing none, we'll cast a yes vote for all members present. Motion passes unanimously. Thank you very much. And then we'll go on to item 6 on the public safety agenda. Resolution extending the intergovernmental cooperation agreement for police services with the Village of McChesney Park to May 31st. So basically it's we're adding a little bit of time for continued negotiation or discussion. So it's a motion to extend the current contract until May 31st. May I have a second? Mr. McDonald, Mr. McDonald made the motion. Mr. Billick and Mr. Gurl made the second. Item is now before the board for questions or discussion. We do have the deputy or the chief deputy here. If there's any direct questions, Mr. Schultz has his hand up.
Yeah, this is just a helpful clarification because I'm not on public safety and so I don't get these regular updates. But at one point, the Village of McChesney Park had initiated whatever action was necessary on their end to terminate the agreement. And there was a long window of time, the early notice that they had to give to terminate the agreement. And so they took advantage of that with the possibility that they would then do this on their own. And I'm not up to date on what the latest conversations are in regard to their interest in taking this away from the Sheriff's Department.
Would anybody like to respond or answer Mr. Schultz?
I can respond. Hello? Hello?
Yeah, I'm sorry. Dave Linkus or Chief Sagan, anything to add?
I can answer the question as well if you'd like, Mr.
Go ahead.
Chairman.
Go ahead.
So at this point, we've, as I think I mentioned during the committee meeting, we've been negotiating since January. I think that there is the intent of McChesney Park is to continue the service with the sheriff's office. We're very near to contract at this point. We're just going back we have an agreement in principle. The state's attorney's office reviewed the contract and wanted a couple updates, a couple tweaks. So we probably, the 31st is a good date. We should have a contract by then.
Got it. So the indication is it'd be staying with the county with firming up.
Chairman?
Yes, sir.
I see State's Attorney Ross is trying to get in here and make a comment, but I know she's breaking up a little bit. Just to basically supplement what the deputy chief has said here. We've submitted a revised contract to the one we were initially given to the attorney for the Village of Chesney Park. I think Steve has gotten the finances pretty much under control. We just made some changes to make sure that we preserve some of the features in the existing contract, and also protected the sheriff's ability to make sure that he's absolutely in charge of the policing of the Village of Chesney Park. And Rick, I turn to you and see if you agree with that.
Yeah, absolutely. So at this point, I think that we're very close to an agreement, and like I said, this 1 month extension should be more than enough time for us to finish up and get this contract settled.
Okay, thank you. Any other discussion? Seeing none, are there any board members who are opposed to this motion? Seeing none, we will ask the clerk to cast a yes vote for all members present. Thank you very much. Motion passes unanimously. Personnel, we'll move on then to the next committee. Mr. Booker, thanks for letting me pinch hit for you. Personnel and Policy Committee, Mr. Fiducia.
Thank you, Mr. Chairman. No report.
Thank you very much. Any unfinished business by the board? Any new, oh yes, under unfinished business, Mr. Arena.
I just wanted to report. I just want to report from the ad hoc committee that the advertisements are out for our new for the search for the administrator, and they expect, I think the deadline is May 9th to have applications in, and after that we'll be able to start going through the candidates. So I just wanted to let everyone know that the search is in progress.
Thank you very much. Appreciate that. Any other unfinished business? Under new business, we got two items: the county board district for appointment, and then county board district for next steps. So my clear understanding in talking to Mr. McDonald is that just as a review, we called for applications when the District 4 opened up. 3 people came forward publicly. We had interviews set up. One of the candidates dropped out, and then we interviewed publicly, and there was a lot of follow-up with 2 of the candidates. It's my understanding at this point that there is nowhere near majority support for either candidate. Although I respectfully think that's a mistake. I think there was one exceptional candidate, and I think both candidates would be a nice addition to the board. That is what it is. So what I understand with that item is that there's really no action to take at this time. We would extend the process, and we would move forward and with the intent of filling the position. There are at this point, and again, my disappointment aside, and missed opportunity aside, in my opinion, there are a couple of additional candidates who also appear to be solid folks who have indicated that if this process continues and that we do not appoint one of the first 2 candidates that have been formally interviewed this evening, if that is in fact the case, that there is interest from a couple of others to be considered in a future process. That's what I know at this time. Are there any comments or questions at this time? I have Mrs. Crosby first hand up. Go ahead and unmute yourself, Jean. There you go.
Yeah, thank you, Mr. Chairman. I'm thankful that we had a very transparent process with the first 2 candidates. I agree with the chairman that we had a really good candidate that did not have the support from our caucus. However, our caucus hasn't met as yet, and we need to do that sooner or later. Having said that, my only prayer is that the next two candidates have the same transparency and process and mirror what the last two candidates were able to embrace. So I encourage the chairman to go ahead and post the position again, gather resumes, provide a transparent process that any of the board members or anybody from the public can enjoy and review. And that is my hope. So, Mr. Haney, I hope you take that route. Thank you.
Thank you very much. I see a couple hands up. Mr. Webster, go ahead.
Yes, thank you. Just an update here or a reminder either way. The precinct committeeman from the district from which their vacancy has occurred, District 4, the precinct committeeman who, I'll remind you, have weighted votes, and they have unanimously chosen a candidate that they want to replace Mr. Boomer. And that name was forwarded to the Central Republican Committee. The Central Republican Committee has acknowledged that, and they are in agreement with pushing that name forward as well. The name of Mr. Mike Zintak.
Okay. Any other comments? Any other follow-up, Mr. Webster?
Well, not at the moment. I'll reserve comment here for a moment.
Okay, thank you very much. Any other items? Follow-up, Mrs. Crosby. Oh, unmute yourself.
We go again. Thank you, Mr. Chairman. Mr. Webster, how many precinct committeemen are endorsing this individual?
Thank you.
Unmute.
I believe there are 5 precinct committeemen, and all of them are endorsing this individual.
Are all 5 precinct committeemen from that district?
Absolutely. That's what I'm telling you.
Okay, thank you.
It should be that way. It should be the ones that are closest to the district that make those decisions. The people that know the people that are in their district or neighborhoods, what have you. That's who should make the decisions, who they want to represent them. And this is the man they chose to represent them. Thank you. And
So assuming that we do not appoint one of the 2 candidates that came through the initial part of the process, the gentleman you're referring to, then we could connect with him. I believe there is another person who is interested and has come forward and indicated interest. I don't know who knows what and when and who's what and who's up and down. My thought is that you interview, if we're not going to take action this evening on the first 2 candidates, then we open it up, see what we get. It sounds like there's certainly multiple candidates who are interested, and maybe perhaps more. And we could potentially turn this around in short order. Any other questions or comments? Mr. Schultz, then Mr. Arena.
I just need to go on the record and express my frustration with what you're saying, Mr. Chairman, because at the last meeting, we had a very clear articulation of the historic and preferred process. We heard from the Democratic caucus that they would be supportive of that process. Mr. Webster just outlined that we have in fact followed that process, and we've reached the point where there's a recommended candidate based on that historical process, based on the recommendation of the precinct committeeman, based on the input from the central committee, and based on the recommendation that is coming from the caucus. So the fact that we're meandering around the conversation relative to someone that you wanted to be appointed to that role that does not have the support of the precinct committeeman or the historical process is something that's frustrating. I think you need to move on from that disappointment and accept the process as it has been in the past, and as both the Republican and the Democratic caucus have said, that's the process that they're going to follow. That's the process that they're going to support, and just move ahead and not belabor the process anymore.
Did I see any other hands up?
Oh, mine.
Mr. Arena.
Thank you, Mr. Chairman. I just kind of following in the same line of what Mr. Schultz was saying. And I've never been part of this process before. Has there ever been a time where a board member has been appointed over the recommendation or against the recommendation of the local committeeman? Has that ever happened before that anyone's aware of?
Yeah, I don't know. I know that the trade unions put the person in District 4 pretty much in that in the past. So I can't speak to what other people chipped in, but I know what drove that process very, very intimately. I don't know anything else. What I will say is I am surprised actually at I'm surprised because I've had multiple conversations with Mr. McDonald. I'm not aware that the Republican caucus has. I am not aware that the Republican caucus has done that, because I talked to Mr. McDonald about, well, here's where we're at. There's not a recommendation. There's not close to a majority. And then names started coming forward because multiple people started recruiting other candidates. It is my understanding, clear understanding, that even some of the people involved in that discussion were not aware of other candidates. I don't know what I don't know. What I do know is that we are within our 60-day window. What I do know is that I spoke directly to the new Republican caucus chair, and I got off the phone the other day and was under the clear understanding that there wasn't support for candidate A and B. It had less to do with disappointment and more to do with reality, that to move forward without opening it up and taking a look, having the entire board, having the entire district, not 3 or 4 people within it, to be able to see people and ask a question or two would make sense to me. There was not, in my multiple, almost daily conversations with Mr. McDonald, what I thought was a whole lot of disagreement on what was going to be next. That's my understanding. Mr. McDonald, do you have your hand up?
I do, Mr. Chairman. Thank you. And I just want to address this really quick. I know you and I were on the phone till nearly midnight on Sunday. I expressed to you as my desire to come as close as we possibly can to a unanimous decision with the Republican caucus. I agree with you that we're not there yet. I would like to get there. I think we've been fractured in the past. I would like to see us become closer than what we once were. So if we could allow this process to play out and get everybody on the same page, I would love nothing more than to next meeting come to the Democratic caucus and the county board as a whole with a unanimous decision.
So just to clarify for the record, with Mr. Schultz being upset over my disappointment is what it is. That said, that's not what drove the discussion tonight. What drove the discussion tonight was actual conversation with the Republican caucus chair around next steps, not to disrespect Mr. McDonald, not to disrespect the Republican caucus, not to disrespect the county board, not to disrespect the District 4 citizens, but it was with the understanding that that would be what would be next. What we have an opportunity to do is perhaps interview publicly the 1 or 2 or 3 or 8 people that may come forward and be interested in the next couple of days, and turn this thing around at our next board meeting. To me, that's very doable, but I can tell you that people disagree all the time. But what I thought walking in tonight, that I was not acting in misalignment with the person I've talked the most on. It was, yeah, this is not a perfect situation, but this is how we'll deal with it going forward. Mrs. Crosby on a follow-up.
Thank you, Mr. Chairman. Here's what bothers me. Steve Schultz talks about the Democratic caucus embracing a certain individual, and Steve Schultz talks about the Republican caucus embracing a certain individual, and the Republican caucus hasn't even met. So there's all these side conversations and backroom conversations occurring that don't include all of the caucus. So I'm bothered by the fact that there hasn't been a transparent process where everybody's included except a certain few. And I find that offensive and I find it wrong. I do not agree with the fact that the Republican caucus has selected a candidate because I have not been included in any of those conversations. Now, having said that, because you disagree with certain people in your caucus, they cut you out. And we know who they are and what they do. Oh, I see your hand, Webster. You're going to talk. Absolutely. Having said that, if we're going to move forward as an entity, we have to be able to embrace transparent conversations, open conversations, be willing to disagree and still treat each other respectfully, which has not happened since I came on this board in 2016. And I find that appalling and wrong. Sooner or later, we all got to grow up and step in. And I have not seen that in the 4 years I have been here.
Tell him they can't see me.
So I'm done, but I'm here to tell you, for Steve Schultz to tell me that the Republican caucus has embraced this when the Republican caucus haven't met is wrong. I like you, Steve. I appreciate you, Steve. I respect you, Steve. But what you said tonight was wrong. Thank you.
Well, I'll move it along, but I just want to say this is that Mr. McDonald at the beginning of this process talked to me and he asked me, he said, I want this process to bring the board together. He said to people who have other opinions, I want this to. He's asked me for to give him room in this process. I believe that between the joint committee, joint caucus being set for Monday that had a very specific purpose, things changed over the weekend with some folks. And so then we had a set with things. So I can't speak to all conversations. I can tell you, my goal here is not to be in a fight during a COVID pandemic and actually progress we're making in other areas. That if you think that's what I set out to do, that actually is not the case. I understand the frustration. We all win and lose some. So, I've been there as much as anybody else. I will say this is the conversations I've had with Mr. McDonald to this point have been very upfront to me, asking him to have room to work the process. And if Mr. McDonald would have been animated about coming into this meeting that I was somehow disrespecting him, or if that was the case and we were at odds, there would be a different conversation. But I didn't act in a manner where I thought I was undercutting or disrespecting any part of the board or the Republican caucus. We do see this differently structurally, but that's okay. At the end of the day, I was, and I said this at the beginning, I hope we get to the point of having a very supported new candidate to fill out the rest of this term. But I can tell you I'm not trying to not work with Keith specifically, but I also know he got thrown some curveballs with some people coming forward and some conversations occurring with good intention, perhaps. And I think we're just evolving on some of that stuff. I don't know past that. I don't know. But I understand your frustration, and honestly, I've shared that frustration at times with Eugene. But I can tell you, Keith and I made a commitment that we were going to attempt to do this in a manner that wasn't going to further be divisive, and I'm trying to do that. And
I know that.
Disappointed, but I have not been adversarial in this. I didn't bring forward the person I really think would do an excellent job on this board, and I could have put that in front of you for a vote tonight. And I could hold this process up. I'm not looking to do that. I am not looking to do that at all. And I apologize if that came off any other way. But at the same time, I think it would be disrespectful to the community and to the District 4 folks that we don't actually let people that want to have a public seat have the same interview that people that didn't earn your support get. And if we do that, then you guys can have a caucus meeting, talk it out. I know whatever happens, and we'll figure it out. And if we do that, I think we'll be better than taking action tonight, even if that turns out to be the best person. I don't know, but that's where we're at right now. So I mean no disrespect. I'm not trying to be at odds with anybody. But, you know,
Mr. Chairman.
Jim wants to talk, but I would like to talk before Jim. May I?
Well, I would like to talk at all.
You go ahead, Laurel.
First of all, us Democrats should not be part of any of this. The Republicans should be holding their own caucus, period.
Oh, right.
It should be a private thing between all of you, not Democrats.
Right.
The only
That's
time a Democrat gets involved is when the chairman brings the recommendation to the floor. And only then do we vote as a whole. Until that time, none of you should be doing this for the public and everyone else. This is a Republican situation, not a Democrat situation. Keep us out of it. Get yourselves together. If you have to go on Zoom together and argue this, do so. I don't want to hear about it until you actually bring the recommendation to the floor. This is how I got into the Polly Berg seat. I went before the precinct committeemen. I went through the caucus. That's how you get in. This is how they are voted. You have 4 or 5 candidates. You don't argue over the candidates. You just bring them all in at one time and listen to them, and then let the precinct committeemen make some suggestions. You as a caucus, if you don't agree with them, you can argue with your precinct committeemen. But we're wasting time tonight and all these other nights talking about something us Democrats should have no part of. Thank you.
Mr. Chairman, can I speak, please? This is Joe.
No, yeah, I have Mr. Webster, and then I have you, Mr. Hoffman.
Go ahead. Let Joe go first.
Go ahead, Mr. Hoffman.
Thank you, Chairman. I just want to even go a little bit further than Angie. I thought I heard Ms. Crosby referred to and I don't mean this disrespectful, Ms. Crosby, but it was a comment made that the Democrats have made a choice. Democrats have not made any choice. The Democrats have said all along they will support the Republicans' choice, and I'm looking at it, it's the choice Mr. McDonald's gives us. So that is how I'm looking at it. So the Democrats I agree with Angie, don't put the Democrats in this. We have made our position clear from the very beginning, and I did it on purpose because I didn't want this. Thank you.
Mr. Webster.
All right, thank you. First of all, no, the caucus did not make that decision. I want to make that perfectly clear. It was the Republican Central Committee. The Republicans made that choice. And so the Republican choice is what Joe and Angie have just told you. This whole thing about having the interviews blown up for everybody, this is something that Frank created. And this has just created more confusion. It's exactly what it's done. And I think you, Frank, I think you kind of relish that confusion, whatever. It's not something that, sure, everyone can be interested in it. Absolutely. But once again, it's a decision that came about from these precinct committeemen. Now, the precinct committeemen there, don't downplay their role, because they were elected, just as you were. You were elected to represent your district. Those precinct committeemen were elected to represent their district, where they live. And so that's the person that came before them that they want to promote to us as Republicans, not as Democrats, but as Republicans. Now, as far as the Democrats go, the Democrats that I have spoke to, including the aforementioned ones, have said, whatever we decide as Republicans, they're behind us. So are we all gonna, as a Republican caucus, gonna agree on the same one? No. But if the preponderance of us does agree on that, then that's great. And so with us, we still bring that name forward and do that instead of dragging our feet. I mean, we could drag this out forever, of course. And by the way, that 60-day window, sure, the state recommends a 60-day window, or says 60 days, but there's no teeth. That's a toothless tiger. And so there's no teeth in that. And so if nothing happens within that 60 days, nothing happens to us. We don't get challenged by the state. It doesn't go to a judge or anything like that. It's just out there. And this position could remain open until the next chairman comes into a position this fall, and then that chairman brings the name up then. So if you want to keep delaying it that long, that's okay. We can do that. But once again, these other folks that we're talking about have not gone and talked to the precinct committeeman. They don't have their name put out by the precinct committeeman. You have one name put out by them, and that name, once again, went to Central Committee, and that's the name that came forward back to us now. Thank you.
So I would just say this here is there's two board members who have speculated about my intentions on this. I would respectfully push back and say, listen, we can disagree on going left or right, but the intention of having an open interview in any process filling a vacant elected official position, whether it's county clerk, state's attorney, county board, they're all very important. The idea that you would make it open in some form or fashion is not to disrespect the county board members. It's not to disrespect precinct committeemen. It's certainly not to disrespect the Republican caucus or any caucus. It's to say this is a public position, and the idea that people, all board, everybody could put their eyeballs on somebody and get a feel for them. They're going into a public position. It's not like anything else, any other job in this community. I don't think that's disrespectful to anybody. I think it's very respectful to citizens. I would also respectfully disagree, not because I'm attacking your intentions, Mr. Webster. I just disagree with the policy position that we would not work through this process to conclusion, and that somehow we would wait until the end of somebody's term and have somebody else put in months from now. That's actually collecting taxes from District 4 citizens without representing them. So I don't know that we want to wait that long. I think that disrespects voters and citizens at a very consequential time. I would also point out, for the record, that in appointment processes, which become the ugliest things I've ever seen at the county, the following things have happened. The person who quit the position that we're filling called up and wanted to fight on the phone right before the last set of interviews. He's a precinct committeeman. He probably got 10 signatures to be a precinct committeeman. Another precinct committeeman is so steeped in county politics. There's nobody more steeped in county politics. He's every right to his opinion. My point is, I've had the following things offered to me with open vacant seats: guaranteed reelection and a whole bunch of money. Think about what I'm saying. We've had a lot of things offered behind the scenes. So if we want to go there, let's go there. You want to play games? Let's play games. So we will have open interviews, Mr. Webster. You do not have to attend. But at the end of the day, it's going to move forward in an open, transparent process. We will listen very closely. I haven't gotten a recommendation from the Republican caucus yet. That will be helpful when we do, once we have these interviews. The amount of things that have been threatened, cajoled in appointment processes is not conducive to good government. Any other questions or comments? Yes, sir. Mr. Salgado, then Mrs. Crosby.
Yes, I'd like to motion to adjourn, if you don't mind. And,
No, good idea.
We got a
Good
second
idea.
motion by Mr. Salgado, a second by Mr. Fellers. Any opposed to the motion? Thank you very much. Have a great night. Mr. McDonald opposes the motion. Everyone else, I believe, is a yes vote, and we will adjourn the meeting. Thank you.
Thank you.